Thank you. We're going to go ahead and get started and power through. I appreciate everybody staying and the importance of the information, but now we turn it over to Ms. Taylor and Mr. Damler.
Thank you, Chairman Brown. You guys hear me? Allison Taylor. I'm the Director of Indiana's Office Medicaid and Policy Planning. I am going to very quickly turn it over to Rob Damler. He's our actuarial consultant, and we'll talk through an update to our forecast.
Good morning, everyone. Again, my name is Robert Damler, and I'm a principal and consulting actuary with the local actuarial firm Milliman, and I'm a member of the American Academy of Actuaries. And so today we're going to walk through an update to the budget forecast for state fiscal years 2020 and 2021. So this update is an update to information that was last presented to the Budget Committee in April of 2019. So looking at slide 2 of the Medicaid forecast, we have updated enrollment and expenditure information through the end of September. So this is through September 30th of 2019. Again, that's important to understand. We have paid data. There is a lag between payment timing of claims and when services are incurred, as well as eligibility. There are some eligibility that will occur retroactively. So we do try to understand some retroactive eligibility enrollment, but we're working with data and information through September 30th. We do have some prior period adjustments that will be reflected in this Medicaid forecast. We have gone through and updated our enrollment growth and cost trend from the historical data that we had previously. And we have a few approved future program changes that will be discussed throughout this presentation as well. So one of the things that I would like to do is just emphasize, we do provide on some subsequent slides a brief waterfall of reconciliation between the state fiscal year 20 forecasts for 2020 and 21 from what we did in April versus what we're presenting today in December. I'm going to just briefly review the expenditure and funding sources for the Medicaid assistance program. Many of you are very familiar and have heard these discussions several times in the past, but just to reiterate a few of these things. First of all, the Healthy Indiana Plan, Hoosier Care Connect, and Hoosier HealthWise are all our Medicaid managed care programs that are operated by Medicaid managed care plans in the state of Indiana. Those programs provide approximately 50% of our expenditures on a state and federal basis for this program, and encompass more than 80% of our members are enrolled in these Medicaid managed care plans. Those members include Healthy Indiana Plan, which is our adult populations, both parents and childless adults, through the expansion. Hoosier Care Connect, which is for the aged, blind, and disabled population, those who are non-dual eligible, so they don't have Medicare coverage, they only have Medicaid coverage. Those individuals are enrolled in our Hoosier Care Connect program. In Hoosier HealthWise includes some of our pregnant women, but not all of our pregnant women, but mostly our children and CHIP programs are enrolled in Hoosier HealthWise. So those are our three large Medicaid managed care programs, encompasses approximately $7 billion of expenditures in a year, which is about 50% of our Medicaid expenditures on a state and federal basis. We do still have a lot of our members in fee-for-service. So I briefly spoke about retroactive eligibility. So members sometimes receive coverage in Medicaid for prior periods. Those are fee-for-service. Individuals who are in institutional settings, such as a nursing home facility, are also in fee-for-service. Those who are in home and community-based waiver services or long-term care community care programs are in fee-for-service, as well as all of our dual eligibles. So those individuals that have both Medicare and Medicaid are in fee-for-service. So you can see those lines. This fee-for-service line encompasses hospital, physician, pharmacy, and other professional services. We have long-term care, institutional, and community care, which represents about 25% of our budget. It's about $3.5 billion a year between those two line items. Institutional care is primarily nursing home. Community care is our home and community-based settings, including our assisted living programs for the aged and disabled waiver program. The next several line items are less claims direct and more institutional type payments. We have the Medicare buy-in and clawback payments. Those are to Medicare buy-in pays the Medicare Part B premiums for our dual eligibles, and the clawback was created back in 2006 when Medicare Part D program was created to provide pharmacy benefits to those on Medicare. They instituted a clawback payment where states have to transfer some state funds to the federal funds. Rebates and collections are primarily pharmacy rebates. We do remove the CHIP expenditures from this forecast. So as I mentioned, CHIP is included in Hoosier HealthWise, but since this is the Medicaid assistance forecast, we move them to their own forecasted numbers. And then we have the DISH and UPL payments, which are in the other expenditures line. So you can see that we're right at $14 billion on a state and federal basis. However, much of those funding sources do come from the federal government, intergovernmental transfers, provider taxes, or cigarette taxes, and HAF funding. So there are other sources available to us. Bottom line, if we look at the bottom right-hand corner, we are projecting a slight positive in 2020 of approximately $31.7 million and a slight negative in 2021 of $15.5 million shortfall. So over the 2 years, we're currently projecting about a $15 million surplus to our to the Medicaid assistance appropriation. That's less than 0.5% of our total, close to, right at $5 billion of total state funds in the Medicaid assistance forecast over this biennium.
Representative Porter.
Thank you, Mr. Chairman. In April, we had a projected Medicaid shortfall of $60 million. Is that correct?
I don't have those values in front of me at this point in time, so I'll rely on that.
You don't. Okay, so you don't have any numbers?
I don't have the values from April here with me
Okay.
at this time.
Well, to my recollection.
Okay.
All right. We had a $60 million shortfall. Then we came back, Mr. Chairman, ladies and gentlemen, we came back, and a few months later, during a closeout, we reverted $182 million back to the budget. Mm-hmm. So 3 or 4 months later, we're plus some dollars, and then we had additional $40 million that was reversion toward 2020. So I'm really just perplexed about this whole, your forecast and what the results are going to be. And now we projected, I look at your numbers, you're looking at, and $15.5 million shortfall in Medicaid funding for 2021. But we had 182 million reverted, plus additional 40 million in Medicaid for fiscal year 2020 in regards to the surplus statement. So I don't understand. I mean, I know arithmetic, I don't know math, okay, when it comes to this. So help me understand where these numbers are, because when I look at your 15.5 million shortfall, and I look at 2020, in April this year we had $182 million surplus in July, and then now's a total swing of between the $60 million and the $182 million. It's a $242 million swing in regards to that. In your numbers, that from what I look at it, from this statement. So I'm just want to know where the numbers are, how I mean, because I'm confused.
Okay. So with regard to some of the reversions, I would like to ask the Chief Financial Officer for Family and Social Services, Paul Bowling, to address those. As the actuarial contractor, we're not responsible for reversions between state departments.
Yeah, and maybe we could have the budget director, if you don't mind.
Director.
Yeah.
Well, I know you, okay, that's fine.
Yep, let me
I
try.
just need some answers, because,
Sure.
obviously, he's staying in his lane.
Yep.
Which is pretty short.
So the document you see here, not only does it forecast out for the next 2 years, but it also kind of recaps where we landed last year. Just what was that surplus for 1 year? So last year, you can see that the 1 year surplus would have been this 15.7 million, basically of the trying to find the general fund, of the $2.2 billion that the General Assembly appropriated from the general fund last year, plus $6 million of Tobacco Master settlement. We didn't spend about $16 million of last year's money. Every Medicaid forecast kind of recaps the prior year, and so you can see in this one in 18, there was money left over at the end of 18 as well, and so there had been dollars accumulating unreverted at Medicaid. If you were to look back at the forecast every year, you could see that there were unspent dollars. We were setting them aside for helping out with DCS, other things like that. But then when we put the governor's budget out in January, on that surplus statement, it showed, and I forget the exact number, but that January 10th-ish, or whatever that date was, surplus statement, showed that we were going to revert $315 or $316 million. When we got to closeout, we reverted that $182 million that you spoke of. That was based primarily upon prior year information, or prior year excess dollars that were still sitting there. We left a little bit of, I shouldn't say we left a little bit, we left approximately $72 million, I think, intentionally unreverted at Medicaid to help out with hepatitis C treatment costs as well as smoking cessation costs. And then because at closeout, we don't have complete information about where Medicaid's going to land for the year. It takes a few months after that before everything's reconciled. We made the decision of $40 million that we thought would materialize, but we wouldn't know for sure. We were going to wait until this fiscal year to revert those dollars. When Medicaid, if you looked at the previous Medicaid forecast, this $15.7 million that was the actual for last year was forecasted to be $84 million. So for 1 year, between April and when we actually got the final information for the end of the year, that swung by that $70 million. And so the surplus statement that we passed out earlier removes that $40 million reversion just because it's not there. And then also the dollars that we set aside for hepatitis C and tobacco cessation, also used to do an increase for home and community-based waiver providers. That amount left over, let me try to do that math in my head. Instead of having 70 million sitting there, it's probably something more like 30 million sitting there, 30 or 40 million sitting there. And I know I just went through a lot of numbers really quick, and if you want to sit down and let me show you kind of line by line, I'd be happy to do that.
Well, yeah, I'd like to sit down, but I think the public should also know these numbers. Because when I look at the surplus statement, from Medicaid surplus and current balance, which was $349 million that you have in cumulative surplus balance. I mean, we can sit down and talk about it, but I just want the the public understand about Medicaid and where the dollars are, where they're not, and in regards to the Hep C, that's Department of Corrections, right? So,
To clarify,
yeah,
you're
unpack
right,
that
we
for
do
me.
have, we have Hep C costs at Medicaid, we have Hep C costs at Department of Corrections. But the thought has been that by using Medicaid's larger purchasing power, just, they're buying more of these treatments than corrections, because they cover more people, that would be a good place to leave some dollars to help pay for some of those DOC costs there as we're trying to leverage those dollars.
So that was enacted in the budget, correct? No,
No, those.
no, so this was a side, this was,
These were dollars that were unreverted to try to help out with hepatitis C treatment costs.
okay, for now.
And Representative Porter, I will be walking through on a subsequent page a waterfall discussion of how we move from the April forecast to this forecast. What are the changes? Some of the discussion questions that you had are more reversions of the Medicaid funds, which is not reflected in our forecast here specifically. Those reversions are, part of the state budget responsibilities. Ours is really comparing it to the appropriation that was provided to us through legislation. But I will be able to provide to you in a subsequent slide here a comparison between what we presented to you in April versus what are we presenting to you today in December.
Senator Brown has a question.
Thank you, Mr. Chairman. With respect to your rebates and collections, you said mostly from pharmacy. Is this because it seems to be goes up a little bit in 2018, it did, but then it seems to stabilize somewhat. So actually, anyway, I'm curious. I think last year you were in the process of renegotiating with pharmacy contracts with the PBM. So is that transparent now? Do you see the rebates that they receive that then are passed on? Can you give me a little detail on that, please?
Senator Brown, thank you for the question. So we have, with our health plans, moved to transparent and pass-through pricing within our contracts. So that is available, and that does impact, I think, some of our rate setting and capitation work that Rob would be familiar with. But yes, we, as a state, have moved to that model.
So that means then if you know that the price they purchased it at, you know if there's a rebate, so that you're able to price it accordingly when you pass it on to or pay for it, I guess, right? For the patient who's the end user.
I'm going to let Rob.
I'm not sure I asked that probably.
Yeah,
I think
so
you know what I'm asking, though.
Yeah, a couple of issues here. Most of this money is from the federal rebate program. The vast majority of this money is under the federal rebate program, which was created under OBRA of 1990. Under that federal rebate program, there are two levels of rebate pricing that happens. One of them is a base amount, and one of them's an inflation rebate amount. And so state Medicaid programs, through the rebates, are somewhat protected that prescription drug costs won't go up by more than inflation, standard inflation, the standard consumer price index. So we actually receive for every dollar we spend in pharmacy to the pharmacy itself, the retail pharmacy, we receive back approximately 60 cents. So most of this rebate money here is from a program that was started approximately 30 years ago.
Okay, but through the federal government.
Through the federal government.
So since
rebate.
1990 then, Medicaid, sort of, what's the word I'm looking for that's appropriate? Puts an artificial price because it limits the rate a drug price can go up, but that's not the price of the drug then. So in other words, pharmaceutical drug A, we are getting a better price for our Medicaid patients, and as you said, 60 cents of every dollar. But that's not the price of the drug. So if we saw those prices, if we were able to look at the numbers that you have, since it's a transparent pass-through, that wouldn't really reflect necessarily the cost of the pharmaceutical company, right? Or what they're charging in the marketplace.
Correct. So there is a price point that we understand what is paid to the retail pharmacy. So one of what Director Taylor was trying to help understand is that previously a managed care plan would write a check to a pharmacy, let's say CVS or Walgreens, whomever. They would write a check, and in that check, they may have written a check for $20 for that prescription, for the cost of that drug. And what we're now seeing, however, when it was reported to us through their PBM, we may not have seen that $20, we may have seen $25, because the PBM was charging, these are example numbers, not real numbers, but just examples. Let's say they charge $5 to administer the claim, do prior authorization, all of those types of administrative costs. So we weren't seeing the 20 that was getting paid to the pharmacy. We were seeing the 25 that the PBM was charging for their administrative costs and the cost of the drug. We have now changed in our contracts with our managed care plans to say, no, we don't want to know what your PBM is charging you, your pharmacy benefit manager. We want to know what you actually paid to the pharmacist. We want to know that $20. So we do have better price transparency in what is being paid from the managed care plan to the pharmacy.
Okay, but at the end, so you don't know what they're purchasing the drug for still, do you?
That is not directly reported to us from the managed care entities. We know what they pay to the retail pharmacy.
So so under Medicaid, are we still capturing all of the savings, if you will, or the rebates, or do we know that?
Yes, we do. So under the Affordable Care Act, the OBRA 90 rebates, the federal rebate program, prior to the Affordable Care Act, those rebates did not apply to pharmacy drugs within managed care plans. But ever since March of 2012, those rebates apply, those federal rebates do apply to prescription drugs within managed care plans.
But the federal rebates are rebates the feds are giving us. I'm talking about the rebates that a pharmaceutical company may give. Are they the same? It doesn't sound like it's the same.
No, they are different.
Yeah.
And so we do have the health plans report to us when we are negotiating their capitation rates that we pay to the health plans. We ask them to report to us their rebates as well, and we reflect that in our rate setting process.
Okay, thank you.
All right, so on the next slide, slide 4, I want to just highlight some of the key findings from this forecast. The first item that we have itemized here is hepatitis C expenditures are emerging lower than expected. Primarily, we had focused on targeting that we thought that we could target 9,000 individuals with hepatitis C for treatment in both 2020 and 2021. However, we are not meeting, the number of lives are not emerging through that.
I might comment from a policy perspective. So this is really kind of a two-part process. From a reimbursement perspective, we've identified the mechanism, and we are now in the active outreach education phase, partnering with ISDH. What we know is that, we need to get individuals tested and then treated, and involved in that is partnering with providers and addressing some stigma associated with serving in the space. So we are actively recruiting, and you'll see more of this. I know Dr. Sullivan, if she were up here, she would tell you about some of the initiatives we have, like our ECHO training program, focused on spreading best practices and evidence-based treatment with hepatitis C. So we shot big, hoping that everyone impacted would show up, on the first day or in the first year. That didn't happen, but we are committed to building, and we anticipate this to continue to grow. So I just wanted to provide that context.
Thank you, Director. The next item is enhanced hospital reimbursement. Several years ago, we moved to a hospital assessment fee and increased reimbursement to the hospital providers for both inpatient and outpatient at approximately Medicare reimbursement. Our target is to reimburse them at Medicare reimbursement amounts. That requires a calculation each year. You can see how the calculation has changed from a 2.7 factor to a 3.0 or 3.1 factor, and then it's going to move down to a 2.7 and 2.9 factor. So those have been updated, and those need to get updated each year. So that's just targeting Medicare reimbursement for our hospital systems. Our capitation payments, those are the payments, the approximately $7 billion of payments made to the managed care plans. Those are updated every year through actuarial certification of rates under federal regulation, but they must be approved by CMS prior to us paying them to the health plans. Currently, CMS has approved us our rates through calendar year 2018. They're still reviewing some of our prior rates that have been submitted to them. So we are trying to make, we're anticipating them approving the rates, and then we'll process those payments over the next 2 years. So there is definitely some timing issue with regard to capitation payments being made to the health plans, as well as the health insurer fee payments for calendar year 18 rates. We still are reflecting 3% cost savings through reductions for hospital and nursing homes through state fiscal year 2021. That is unchanged from our April forecast. This does have a general fund impact of savings of approximately $30 million per year. And finally, our community engagement program for the Healthy Indiana Plan has moved to be a voluntary basis. In our last forecast, we had indicated that it would be mandatory participation through that program for those who had the qualification criteria, and now we have a voluntary program.
The 3% cost reduction, though, is on the increase that is going in for the next year. So there's a base increase and then a 3% reduction?
So it's a 3% reduction, yes, to the base amounts, and then the hospital assessment fee is applied on top of that. So they're still reimbursed in aggregate at Medicare reimbursement. It's just the 3% reduction to the base amount that would be paid if there was not a hospital assessment fee.
Kind of along, thank you, Mr. Chairman. Kind of along those lines, can you explain to me the logic behind a 3%, what did you call that, reduction?
Yeah, so it was a 3% rate reduction.
Rate reduction along with a reversion. If you're reverting money back to the general fund, why are you also, it seems like it's like you're doing it twice.
Might ask Budget Director to comment
Yeah,
on the
I'm trying to
reversion piece.
figure out why, okay, so, correct me if I'm wrong, and I'll reserve the fact that whether or not I'm wrong or not. But the one thing that confuses me is you've got built into your budget a 3% reduction based on some factor. I don't know what that factor is. But then somehow for the last, I don't even know how long, go back on reversions, you're reverting money back to the general fund. That seems inconsistent. Could you explain the logic for that?
I guess I'm not completely sure I understand the question, but I mean, if there was not. Yeah.
If you have enough money to revert back to the general fund, why are you asking for a 3% reduction in the base amount that they receive from the appropriation? If you're going to revert money back, it seems to me that you should leave the money in the appropriated amount and not reduce, and thus reduce the reversion. But it seems like the reversion is happening on top of the 3% cut.
Well, the 3% rate cut and the savings that the general fund derives from that, that's in part what leads to the reversion. So let's take last year as an example. And, you know, we try to look at each year individually. So for last year, if there had not been this, and I'm assuming the fiscal last year was approximately the same, this 30 million?
Yes.
Rob? So last year, one of the slides I showed you that just for that year, we underspent the $2.2 billion appropriation by 15.7 million. And throughout the year, we're really not exactly sure. I mean, there's such a lag with Medicaid that we don't know until months after the fact exactly where we landed. But had we not had this 3% cut there, we would have overspent the Medicaid appropriation for that year.
Which then leads to my next question. But you have a reserve for that situation. I guess what I'm trying to say is, if you're anticipating spending more than you're appropriated, that seems to be the logic behind the 3% reduction, then why have the reserve? Because the reserve is there for the purposes if you spend more than you appropriate. So it seems like you're, I guess, double hedging?
Yeah, I guess I view I think there are two uses of the reserve fund.
Okay.
One, I would say, is for kind of casual deficits, and one would be for taking care of this population during a true decline, an economic decline. In terms of all of a sudden there are a lot more people on Medicaid than the forecast.
But Zach, that's my point. You're requiring a 3% reduction of the appropriation, which says to the people, we're giving you this much money in the budget, and we're not going to let you spend it all. Because, and you talk about changes to the population and unexpected changes to the population. Well, one thing that's expected is the amount that they get is going to be 3%, less 3%. So.
Well, and I'm sorry, we're not talking about holding a reserve on the overall Medicaid program or
Right,
that.
right. So, but it still begs the question, if for a consistent basis, there's always money going back to the general fund, and there's coupled with the 3% reduction in the appropriation spending, on top of that, a reserve that's there for casual replacement, when are we going to ever touch the reserve? It seems to me you should go to the reserve instead of doing the 3% reductions.
And I would say that I think the Medicaid reserve is more for economic decline, not so much kind of just casual year-to-year.
I'm glad you said that. Going back to my point earlier, when the last time we had an economic decline, if my statement was correct and if the chairman's agreeance to that was correct, we were able to feel, when we spent the reserve down, we were able to build that back up from a federal government contribution. So
I really want to get you the right answer, but that's not my recollection. My recollection is that in the Great Recession, the balance in the Medicaid reserve was drained. We used that, plus we had help from the federal government.
Right.
And there was nothing left in the Medicaid reserve after the recession.
okay, but that begs the point, if the last time we drained it, the federal government came in and helped us zero out, why wouldn't we expect it the next time? So having
Current
the reserve.
administration.
Okay, The last time it was a guy that I liked, this time is a guy you like, so I'm assuming you expect this guy
Well,
to come
and
to our
and
defense.
also I
And if
think the economic circumstances of that time period were unique. I mean, the depth of the recession, we've not seen anything like that in my adult lifetime.
I agree, Mr. Chairman.
So I don't think we have seen the federal spending like that, parallel that before.
Okay, last but not least, I don't want to get because that's more of this stuff is philosophical in nature. But one thing that's very objective is on the balance, on the surplus statement, combined statement of estimated unappropriated reserves. The reserves for state tuition and rainy day have an interest component.
Yeah,
Can you explain to me why the Medicaid reserve does not?
happy to.
Thank
So, in the statute, underneath the treasurer's office, it addresses interest earnings there and where interest earnings go. And basically what it says is that unless statute says otherwise, any interest earned goes back to the general fund. And so on these two others, the state tuition reserve, the statute specifically says that it retains its interest. On the rainy day fund, it specifically says it retains its interest. You can kind of look at every fund in statute and kind of see whether what it says about interest earnings, and if it does not comment about interest earnings, then you default to that section underneath the treasurer's office, or under the treasurer's office in code that says the general fund gets those interest earnings.
All right, so the state tuition reserve, and just piggyback it on that statement, the state tuition reserve is for what?
For, I would describe it the same way as the Medicaid reserve. If the appropriation isn't sufficient in terms of the ADM times the population, number of kids, if the formula exceeds the appropriation, you can use it. I believe I'm not sure if there was actually a balance there in the recession, whether we used it or not, but so I would say casual deficits. Also, I could maybe see a situation where if we can't actually, next recession, as you know, we spend roughly half of the general fund budget on education. If in the next recession we literally cannot afford to make those payments, if the general fund cannot afford to make those payments, then the state tuition reserve can kind of slide over to make those full payments, or something close to those full payments.
Thank you.
My pleasure.
Diane?
Thank you. Yeah, I'm a little confused. I'm not sure whether this question goes to you or to Zach. But from everything that I've been hearing and listening to, do we have two different Medicaid funds? And I guess, so I look at this old statement, combined balances, and it says Medicaid reserve, $577 million. Okay, now I'm looking at another one that says Medicaid surplus, let's call it $350 million. Is that a different account?
Yep, and there's probably a third one too.
Well, so, all right, so
so-
wait. So we've got the Medicaid reserve, 579, then we've got this surplus. Where does that come from?
Yep. So there's a general fund appropriation for, I'm not sure what it is. Last year it was 2.2 billion. This year it's 2.4 billion, something like that. So that's a general fund appropriation. I would say almost pretty much every Medicaid payment, and that's the appropriation for Medicaid assistance. Every payment made by Medicaid, and if I'm exaggerating by saying every payment, I apologize, but almost every payment at least has some sort of federal match component to it. Sometimes
Okay, yeah.
it's 2/3, sometimes it's much higher than that. We take those state dollars, put them in our federal fund.
Is that what this surplus is? This surplus?
That's recognizing the unspent general fund dollars that were put in our federal fund. So on a quarterly basis or monthly basis, when are we doing those allotments for Medicaid? Quarterly, we're moving over roughly 1/4 of the Medicaid appropriation from the general fund account over to the federal fund.
So is that what this federal fund, is this balance statement that shows 350?
That is showing the unspent general fund dollars
Yeah.
in the federal fund, kind of as of the, kind of what we knew in July, which at that point, we did not have complete information about exactly where Medicaid landed for fiscal year 19.
All right, so,
And can I just say
Yeah.
one more thing? If you were to pull up that account in the accounting system, that federal fund, it's also going to show the federal appropriations in there as well. So anytime, it's going to show a number a lot higher than what you're seeing there. It's going to show the current year general fund money going in there, plus the kind of full federal appropriation in there as well. I mean, if you went out there right now, I wouldn't be surprised if it had a $10 or $15 billion number out there.
okay, so in this federal fund where we put our state match, that's where we had $350 million extra. And is that where you took, or let's say extra, unspent? And that was unspent as of June, or July 1, or closeout?
Yeah, it
Okay.
was a.
And then,
it
and
was a-
then you took $182 million of that money and reverted it?
So I'll say that it was 300 and whatever that 350 number is.
Yeah.
That's what it was forecasted to be as of the time of that meeting. I think after that, we got better information, and it was something lower than that. And I'm looking at Paul. Say that again? Oh, yeah. So take about 70 million off that number. Once we fully reconciled, take approximately 70 million off of that number. But then, yes, that's where the 182 million was reverted from.
All right, and so, and the 182 came out of that, so it was basically moving money around. You're taking money that you had put in the federal fund from the general fund appropriation, stashed it there for as long as you needed, and then when you get to the end of the year and get closeout, you take essentially, like, instead of 182, now it's 70 million less, so you're taking this 182 million dollars out of there and putting it back in the general fund. Is that what I'm getting?
Yep.
Okay, so how do you decide, given that we've got, we're calling it 577 million in the Medicaid reserve, how do you decide how much money you're going to, stash in the federal fund? Because once you put it there, then it's pretty much unavailable for any other use, right?
Yeah, that's fair. I think, historically, if I went like back and did like a 10 or 15 year reconciliation of what the end of year activity has actually been, there's some years that it has reverted. There might have been that year reversions. I doubt it, just because we usually don't have enough information to know exactly how much is left. Some years there's been a reversion after the year. Some years we've actually we've maybe overspent the appropriation. In terms of the last few years, the thought was, we know we have some needs at DCS. Let's hold this money and prevent reversion. Whenever we were building the budget this time, the decision was, there's a lot of money sitting there. That it does not need to be sitting there, because we have nearly $600 million in the Medicaid reserve. And so at that point, whenever we were building the budget, the 315 or the 316 that we put in the surplus statement in January, that essentially reflected taking everything that was in that balance, prior year money in that balance, and whatever based upon that most recent Medicaid forecast, what we thought would be left over at the end of this year, and basically kind of zeroing that out. I won't say once and for all, but it reflected that we would put all of it back in the general fund, all of the prior year excess.
All right, so let me just ask a couple more questions. The 182 million reversion, is that typical of what we do? Or is it a lot more? Is it less than what we normally would revert as unspent money?
Joe just pointed out that we did 144. We reverted 144 in 2017. I would give you a more, I don't think ever we've been super consistent in this area. Sometimes we've sent that money to the Medicaid reserve. Sometimes we've reverted it. Sometimes we've left it there for other emergencies.
Okay, well,
One thing that I'll point out is that it's truly one-time money. I mean, it's something that was left over from a prior year, so we very rarely kind of said, yeah, let's expand something using this money, because once you use it, it's gone. There's not, we don't build the budget assuming a Medicaid
So-
excess every year.
Can I help? So you use it for next year's appropriation, right?
So
To help offset next year's appropriation, is that correct?
So what traditionally has happened in the last 2 or 3 budgets is that there's a December forecast, and then there's an April forecast. And whatever that difference is between those 2 forecasts, I believe the General Assembly has said, we have more information, I have no, $30 million left over that we did not expect. We will buy down 1 or both years of that next budget's appropriation with that kind of newly found money that wasn't contemplated when we started budget development.
Right, so just going back to now what you have done as a forecast, you're forecasting numbers, and you're forecasting that our spend is going to be, 15 million over, right? But you don't actually know where the money is or where it's coming from, because we may still have this money, like the $40 million, we may still have this money sitting there. Is that what I get from what you're saying?
The 15.5 million overspend
Yeah.
is in relation to the appropriation that was provided for this biennium. So I'm comparing it to the appropriation. You are correct to the extent that you have money in other reserve funds. I am not accounting for those funds. I would say that there was a carry forward, which is shown on slide 3 here, of 25 million for state fiscal year 2020, and a carry forward of 15 million in state fiscal year 2021. So in addition to the appropriation, they did carry forward, as Budget Director Zach Jackson indicated, $40 million. So without those, so over the 2 years, in relation to the appropriation, plus the $40 million, we will have a $15 million surplus. The
And-
31 plus the 31 million in this year,
Yeah.
minus the 15 overspend. But without that $40 million carry forward, we would have had a $25 million shortfall.
Okay, let me just ask then, the $127 million, that's the last number on the second column, carry forward of unexpended, where's that?
That's in state fiscal year 18
I'm
column.
sorry, would you?
The very bottom number in state fiscal year 18 is one carry forward of unexpended expenditures on slide 3, 127.7 million. Where was,
I don't know, I'm asking. Page 3, second column, last number.
Yeah.
Where did that go?
Go for it.
Senator, part of that would have been part of the 182 million that we reverted in fiscal year 19.
Okay.
okay. So I'm going to briefly touch on slide 5, but I'd really like to focus on slide 6. So slides 5 and 6 are a comparison between the April forecast and the December forecast of both state fiscal years 20 and 21. Slide 5 is on a state and federal basis. However, many of these values, primarily the half factor change effective August 1st of 19, you can see that there's a $51 million impact for state fiscal year 2020, but a $500 million impact to state fiscal year 2021. But when we go to the next page, there is no impact on a state general fund basis. So each of these items are shown on a state and federal basis, and depending on the source of those funds, or source for these expenditures, some of them are fully federal funded or mostly federal funded or supported through the hospital assessment fees or other provider taxes or other taxes. So I'm going to focus on slide 6, which is a waterfall between or reconciliation from the April forecast. So that's the top line. Those two values you should be able to look at in relation to your April forecast numbers of the $2,510,000,000 and $2,633,000,000. As previously indicated, those are on state share value basis. You can see that there is no impact due to the half factor change. Again, these are state funds. We are projecting a decrease of about $30 million in 2020 and $20 million in 2021 due to a lower anticipated participation in the hepatitis C program. There's some reconciliation of the power accounts. The next three items are generally 1/3, 2/3 between the federal government and the state shares. So nursing home expenditures, we are seeing slightly higher expenditure growth, so we have more money in for the nursing homes. Home health expenditures, we have slightly slower growth than projected. So one of the things that I would like to clarify here is we have slower growth, but that doesn't mean growth is negative. So if previously we had projected 5%, but now we're projecting 3%, that would have a negative impact in our budget forecast. So when we say slower growth, that doesn't mean negative growth. So in relation to our prior projection, home health care expenditures are slightly down. Division of Aging, we performed a rate update, which was not included in the last forecast, which will have additional expenditures amounts for the home and community-based aging waivers. There's a little bit of payment timing and some additional cash payment timing issues as well. So in relation to what we had presented to you in April, and Representative Porter, this gets back to your question, on a state share basis for 2020, our number has dropped by $31 million, $31.6 million, from the $2.5 billion to the 2,478. And for 2021, our number is up by $15 million, so from the 2,633 up to the 2,649. And those values are the ones that, the values in between show you how we have made changes since our April forecast. So hopefully that helps you understand how the numbers have slightly changed since we were here doing, providing a presentation in April. There are some additional items. I'm not going to hit on any of these unless anyone has any questions, as these will be presented in a subsequent presentation this afternoon with regard to our state plan amendments. So if there's no questions on this immediately, these will be presented later this afternoon. And then finally, I'm not going to hit on all of these numbers. These are our projected enrollment forecast. Our enrollment forecast has changed very modestly from what you would have seen back in April. Again, total Healthy Indiana plan, we have over 400,000 lives enrolled in that program. Those are adults and pregnant women and childless adults and parents. Hoosier Care Connect, you can see our adults and children, over 90,000 members there. Hoosier HealthWise, again, these are all our managed care programs. We have 600,000 lives enrolled in those programs for Hoosier HealthWise. On the next page, these are our fee-for-service programs. 35,000 people are institutionalized. That is primarily our nursing home institutionalized population. So the majority of that is for the nursing home population. Our home and community-based waivers, we have over 55,000 people. And then some individuals without level of care, mostly fee-for-service, our dual eligibles, our Medicare savings programs, et cetera. So I don't know if anyone has any, and these numbers are, we're seeing about 1.5%, 1% projected growth in total enrollment over the biennium. So relatively unchanged from what we presented in April.
Do you work in other states? Are they seeing similar trends?
Yes, we work, Milliman works in approximately 20 states, doing capitation rate setting and Medicaid forecasting work. And yes, they are seeing very similar trends. I would say the expansion population is seeing decreases in a lot of the states. Again, the expansion population being childless adults, oftentimes in the positive economic times that we have, those are going to work and having higher earnings. So most states are seeing a decrease in that population. We saw a decrease in our children population, again, as families have work, have higher incomes. So our children, we saw a decrease, and now we're seeing a relatively flat population in our children program as well. So those are our largest populations. Again, the disableds are not growing. Again, in favorable economic times, those who that generally on the disabled programs also are relatively flat enrollment growth, which is common in other states.
What about the nursing home? I mean, to go from 33,000 to 35,000, that's our most expensive category.
Yes, it is. And actually, you're not quite seeing where this is barely the tip of the iceberg. I may have said this in the past. I do say this quite often. The elderly population for the nursing home will really start peaking between 2027 and 2032. That's when the baby boom generation hits the age of 80. And that is typically the age where nursing home care is highly needed. And I think that's where the state, if you may recall, the state had requested some additional waiver slots in our last forecast, so the aged and disabled waiver provides more home care services, and we are definitely seeing more people using assisted living services on waiver as well. But we will definitely continue to see both our nursing home and our elderly populations have a much greater need as we hit 2025 and later as we progress.
And other states are seeing this as
Other
well.
states will see that as well. I think other states could have a greater impact. The southern states will probably even have a greater impact with many people as they retire move to the southern states. And so, yes, the general inflationary impact or the growth in those populations will continue.
And I think from a programmatic and policy perspective, that puts into light our need to get really focused on rebalancing in home and community-based services, which is, I know we'll probably be back here to talk about that soon, but we hear you on that, and that will be a big focus for us, and is.
Where are we more generous than federal requirements?
I can't necessarily. I think that would have to be a follow-up. I'm not certain where you would, and I'm not certain what you would consider generous, what the definition of generous in your terms necessarily would be.
Making eligibility easier than federal requirements, I guess. I mean, we've had 10 years of economic growth in this state, and yet we continue to have growth in the population. It doesn't make sense to me.
Yeah, so I think we can definitely have that conversation. Our home and community-based services work is going to be significant and in that space. So if you want to drill down on that, we'd be glad to follow up with you.
Mr. Chairman, I from an economic standpoint, just because you have economic growth doesn't mean that growth keeps up with the costs associated with care and services for the elderly.
I'm not talking
Respectfully.
about costs, I'm talking about absolute numbers who qualify.
Well,
We
I
have
s-
more people on this program today than we did in 2011.
That's the
And
baby
yet,
boom.
look at our economic growth in this state, our unemployment rate, our work participation rate. But we have more people on this program than ever before.
I think there's a lot of explanations for that, Mr. Chairman. It's respectfully the percentage of population that's at poverty. Remember, poverty is it moves, and I would agree with you if everything was absolute. But I keep saying this, while we tout the economic growth that we've had, and remember, economic growth is the product of a whole lot of things that move with inflation. So, that could be a result of it. Plus the aging, just the fact that, the baby boomers are probably the largest population could absolutely trade, that's why they call it the baby boomers, right? I don't know. I just found out some of my colleagues are. I didn't even know that. So I agree with you if everything was absolute, Mr. Chairman, but I think we're going to see it keep growing until we start the wages go up. I mean, I don't know.
Any further questions, comments? Representative Porter.
Thank you, Mr. Chairman. Just a quick question. Mr. Haybick, we talked about the accounts, and you said there's 3 accounts, right? So we know 2. So what's the 3rd account, and what are the numbers? Because I like to sit down and do my arithmetic and figure out what's going on.
I was referring to one, the Medicaid Reserve Fund that's on the surplus statement, and then I was referring in the accounting system, one to Fund 150, which is the Medicaid Assistance General Fund Appropriation. That's the second one. And then where that gets moved into the federal fund, which is Fund 30010 in the accounting system, that federal fund is what holds the current year the current year general fund match, the federal appropriation, as well as a little bit now of prior year money.
Thank you. Any further questions? Thank you very much.
Thank you.
We have before us the minutes of the last meeting. I guess I shouldn't, can I have a motion for approval of the minutes? Been moved and seconded to approve the minutes of the last meeting. All those in favor say aye. Aye. Opposed? We have an agenda before us. Are there any additions or corrections to the agenda? Senator Talion.
Thank you, Mr. Chairman. I would like to recuse myself from voting on item number 8 of the review items. And so I'm not sure exactly how this is, but I'd like to make a motion to separate the votes or segregate the votes, bifurcate the vote, whatever you want, but
It's been moved and seconded that item number A be voted on separately as compared to the rest of the agenda. Any further discussion on that item? All those in favor say aye.
Aye.
Opposed, say nay.
thank you.
Okay, we'll vote on that separately when we come to the end of that. So with that, we're going to power through the agency projects. Mr. Smith, Department of Natural Resources.
Good afternoon. I'm here to present one project for the Department of Natural Resources. The Fish and Wildlife Division is requesting $450,000 of DNR capital to complete the final phase of the Visitors Center at Goose Pond Fish and Wildlife Area. This phase will include the installation of interpretive materials both inside and outside the center, as well as the demolition of a barn that was on the property when we purchased the property in 2005. Approximately 30,000 people visit this facility annually, primarily bird watchers and hunters. The Visitor Center was built in 2016 and is approximately 6,800 square feet. The Fish and Wildlife area consists of 9,000 acres.
And this says Phase 2. Is this the last phase of this
Yes.
issue? Okay. Further questions for Mr. Smith?
Where's Goose? Greene County, down around Linton, Indiana. Good question.
Thank you.
Thank you.
Thank you very much. Next, we have the Department of Corrections, Mr. Orm.
Thank you, Mr. Chairman. Putnamville Correctional Facility in Putnam County is one of our medium security facilities. In the spring, we had a sinkhole open up in the middle of the compound. Soil subsidence and a subsequent tunnel collapse have led to an endangerment of the utilities through that facility. It's all the power, data, steam, thermal energy, everything funnels right through where this collapse is. This project provides funding to excavate, stabilize the soils around it, and install a concrete cap over the collapsing tunnel. This was not obviously a planned event. Is when you build a prison in the early 1900s on top of a limestone mountain. I guess this is one of the things that you get to look forward to. We're convinced that this is the final engineering fix for this. I've actually examined the project on site, and I'm on my way there this afternoon as soon as this is over. We're confident this will resolve the situation.
Questions for Mr. Orm? Senator Brown.
Thank you, Mr. Chairman. You say the last fix, has there been other money spent on this?
No, we did spend a couple $100,000 to excavate and open the what has turned out to be a very large area up to know what we're dealing with, to engineer them the proper fix. Yes, ma'am.
Okay. And then I have a sort of a slightly unrelated, I think I don't know if I had emailed you about Westerville. Are there any upcoming plans for any sort of repairs or anything at that prison?
There are a number of things in discussion, ma'am. I'd be happy to sit down and have that discussion with you sometime. It would take a long discussion. We have a number of projects that I'd be happy to have that with you.
At that facility?
Yes, ma'am.
All right.
Further questions or comments for Mr. Orm? Thank you. Next, we have Brigadier General Lyles.
Thank you, Mr. Chairman, members of the committee. I am Brigadier General Lyles, the Indiana Adjutant General. Today, we are requesting $800,000 of state funding to modernize 3 firing ranges at Camp Atterbury in Edinburgh, Indiana. Accompanying the state funding will be federal funding, a federal funding match of $720,000, bringing the total firing range modernization project to $1,520,000. We are improving and expanding these ranges to support our warfight mission as well as our domestic response mission. These ranges will also be used by the Indiana State Police, the Department of Natural Resources, local law enforcement agencies, as well as non-federal entities. Updates and repairs to the ranges will include erosion control, additional target lanes, repairing safety and scoring towers, as well as improved expanded target lines and improved all-weather firing lines. Mr. Chairman, I respectfully request favorable consideration for $800,000 state funding to modernize our ranges and ultimately improve the readiness and lethality of our over 12,000 men and women in the Indiana Army and Air National Guard.
Thank you. Senator Brown.
Thank you, Mr. Chairman. Thank you, General Morales. And when we serve local and out-of-state, state police, DNR, and partner with other entities, do we charge any of them for the use of the range?
Yes, ma'am.
Everyone?
Yes, ma'am. There is a charging schedule for non-federal entities. Our state partners get a credit. So we trade back and forth between budgets, so we don't actually charge.
But not local and not other entities?
Correct.
And then how do you have that fee that you charge? Have you changed that any times recently, or how do you assess that? Determine what it should be?
It's statutory and federal regulation.
Oh, the feds do? Okay, thanks.
Further questions or comments for Brigadier General? Thank you very much.
Thank you, sir.
very much.
Thank you, sir.
Thank you for being here all day. Next, we go to university projects. Indiana University, Dr. Morrison.
Thank you, Mr. Chairman, members of the Budget Committee and staff. I have two projects for you today on behalf of Indiana University. The first one, a very interesting project for the Bloomington campus for the construction of a Mies van der Rohe design building. For those of you that are history buffs, this one is a fascinating story. Originally, there was a building to be designed on the Bloomington campus in the early 1950s, designed by world-famous architect Mies van der Rohe, who has since passed away about 50 years ago. We were working with an alum on a donation, and that alum brought to us and said, did you know about the building to be built in the early 1950s, 1952? We didn't think the story was true. We researched it, and sure enough, and found the plans in the Museum of Modern Art in New York City for the plans for this building that was to be built. It was not built due to financial reasons. That same donor, donors, Sidney and Lois Eskenazi, provided $10 million gift as part of another large gift to construct the building now. And so we are bringing that building back to life. This building will be the last Mies van der Rohe building built in the world, most likely. And it also will have an economic development impact because it'll be on that architectural trail of people wanting to see a Mies design building. It'll serve as an administrative home for the Eskenazi School of Art, Architecture, and Design on the Bloomington campus. It's a relatively small building, and so it'll have classrooms and office space. I'd be happy to answer any questions that you might have.
Senator Brown.
Mr. Chairman, thank you very much. Does the gift include maintenance for the building, or is that going to be absorbed in the university's budget?
It's absorbed in the university budget.
And then the administrative offices for the Eskenazi School of Art, Architecture, and Design, they are now currently located somewhere else?
They are located currently in Kirkwood Hall on the Bloomington campus, and this construction will set off or is part of a series of other domino moves, and then allows us to tear down another building.
Not Kirkwood?
Not Kirkwood, no. Kirkwood's on the historic register, so we can't do that.
Okay, thank you.
So this is replacement, the building's coming down?
Yes.
For this one going up?
Yes.
Okay. Further questions? Next, go
Thank you,
ahead.
Mr. Chairman. The second project, it was part of budget appropriation in the most recent budget bill for Indiana University. We call it the Bicentennial R&R Plan, and so this encompasses major R&R projects in 5 buildings on both the Indianapolis/IUPUI campus and on the Bloomington campus. At the IUPUI campus, we will renovate the Health Sciences building and the Bryson Ott buildings. And on the Bloomington campus, we will renovate the Mathers/Glenn Black Laboratory building and the McCalla building. These were all part of our number one priority capital request that was funded by the state. It is $66 million, full-scale renovation to all of those buildings. Here on the Indianapolis campus, it involves nearly 500,000 square feet of space to be renovated. And then on the Bloomington campus, 2 very significant laboratory buildings. If you don't know, the Glenn Black Laboratory on the Bloomington campus houses all of the state's collections related to the angel mounds that come out of Evansville. And so this will help in the storage of those collections. Be happy to answer any questions you might have here.
Senator Brown?
Thank you, Mr. Chairman. Thank you. So for the IUPUI project, so the buildings that are not currently being used, Bryson Ott, that they're going to be brought back into use?
Yes.
So where is, whatever's going to be there, where is that right now?
So the functions that are moving into Bryson Ott are currently in the Lockfield building, which is right next door. And then the Lockfield building we will bring back to clinical use. And it'll be used by a combination of IU Health and the IU School of Medicine. The Lockfield building was originally a nursing home and came to us in a Wishard's property exchange about a decade ago. We've been using it temporarily as office space, and so the occupants of that will move into the newly renovated Bryson Ott, and then we'll repurpose Lockfield.
And then does this, all this shift, does this change the amount of academic space you're going to be using?
Related to just Bryson Ott or overall?
Well, this whole domino effect on.
The whole domino effect. It will reduce the amount of space that's in Lockfield will be that we're decommissioning that will go back to clinical use. Yes, that will reduce space in that regard. That's the universities. On the rest of the plan, it'll end up being roughly the same.
So in that
And so let me bear that if we were talking about the health sciences building, the entities that are moving into the health sciences building will come from School of Medicine buildings that will be decanted and likely demolished.
Oh, great. All right, thank you.
Senator Taylor?
Thank you. Tom, what is when you say free replacement, that means we pay the state pays the debt service on the bond?
That's correct.
Okay. Do you know what interest rate you're anticipating in the market right now?
I do not. We're probably not going out for another 6 months or so.
Okay. So you have a period of time, I guess this is an unfair question for you. Do you know how long you have to spend those funds?
Typically, after we release the debt, we have 18 months. And we likely at this period do interim financing as we carry the project.
Okay. So you don't know what the interim financing is going to be, interest rate?
I do not at the moment.
Do you know what your last bond issuance rate was?
I want to say it was, it's been a little while. I want to say it might have been 3 1/4. 3 1/4. But it's below that now.
Right. When was your last debt issuance?
I'm about a year ago.
And you know if your rating is going up or down?
Good question. We are in the middle of the rating exercise right now. We're hoping for an answer any time now. Wait, as I think you know, Indiana University is one of only 7 AAA-rated institutions in the country.
You are AAA rated?
Yes.
Thank you.
Yep.
The fee replacement was 2017. Was there a change from the 2017 budget to what it's being used for now?
So there was, in the estimate, perhaps to Senator Taylor's and Representative Porter's question too, in that estimate, there was an excess, a surplus of funds, and so we've been able to rededicate that to this project.
Is that common among universities to do that, or do surplus funds just come back to the state?
Typically come back to the state. This is one because it was related to the Glenn Black lab piece that we were able to repurpose it, working with the budget director.
Okay, and maybe my admonishment for the future would be, don't count on reusing excess funds for projects in the future.
We're very clear on that, Mr. Chairman.
Thank you. Further questions or comments? Thank you.
Thank you.
Next, Ms. McKee.
Thank you, Chairman Brown and members of the committee. Indiana State University seeks approval for an $18.4 million renovation of Dreiser Hall on our campus. This project was authorized for fee replacement bonding authority by the 2019 session of the Indiana General Assembly as a part of the 1921 budget bill. Dreiser Hall primarily houses academic programs in the College of Arts and Science, including multiple communication classes. All student media and video production services are also housed in the building, along with a student-operated radio stations and distance education classrooms. A small theater and scene shop also reside in the facility. Constructed in 1950, the building has limited accessibility for students and visitors, and that access to restrooms and elevators are not available throughout the facility for those who may need handicap accessibility. Fee replacement for this project is not available until after July 1 of 2020, but we seek your approval that we may move forward to prepare construction documents and bid the project later in the spring. The renovation is anticipated to take about 16 months, and I'd be happy to answer any questions that you may have.
Senator Talion.
Thank you. I just missed one thing that you said. You said fee replacement was, is that what you're using for
Yes,
this?
this is a fee replace project.
Okay, all right. Is it a Mies van der Rohe building?
No, it is
No.
not. It is a 1950s brutish architecture style building.
Senator Taylor.
Thank you, Mr. Chairman. One question that I have, well, same questions that I had for Tom, I have for you. When's the last time you were in the market for?
We issued a small direct placement in this past summer, and I believe we closed on that sometime in late June of early July of 2019.
And what was your rate?
I can't quote it exactly. It was around 2.5%. It may have even been closer to 2.4.
What was your rating on that? Or did you do a rating?
We did not go through a bond rating for that specific issue. However, we do every 3 years, rating agencies, whether you've issued debt or not, want to go through that process.
Okay, so what is your current rating with the three?
We're rated by Moody's and Fitch, and we're AA minus and an A1 rating.
AA minus and A1? Okay, thank you.
Thank you.
Again, you're not going out to let the bond until after July 1st?
We would like to be in the, of course, we want to receive bids on the project, first of all, but we would like to be in the market in May and probably close before June 30, but no fee replacement. It'd be October 1 when we would be drawing down our first fee replacement payment for this project.
Okay, so you're keeping, okay, thank you.
Thank you.
Any further questions? Thank you. Thank you. University of Southern Indiana, Mr. Trump.
Thank you, Mr. Chairman. Aaron Trump, University of Southern Indiana. The University of Southern Indiana requests approval to proceed with its capital project centered on the renovation and expansion of 3 floors of the Health Professions Building, which will be updated and expanded with multi-purpose classrooms, instructional laboratories, student study space, and technology infrastructure for students enrolled in health professions degree programs. This project was previously approved by both the Commission for Higher Education and the Indiana General Assembly as part of the 2019 budget and legislative process. There's a high demand for students who graduate from the College of Nursing and Health Professions, and employers throughout the region need graduates with all majors from this college. We believe this is a high-impact project that directly serves USI's mission and the governor's workforce agenda by addressing serious gaps for employers throughout the state, as well as Indiana's public health needs. I'm being intentionally brief, but I have much more information if requested. Thank you.
Any questions? Representative Porter.
Thank you, Mr. Chairman. In regards to this project, I believe this is part of the governor's project of paying cash for this.
It was not initially on that list, but as of 2 weeks ago, the governor mentioned it during his press conference, so we believe it will be now.
Yeah, so if the governor's going to open the budget and do this, are you going to hold off on this initiative till after session? Because I wouldn't want you to go do bond counsel and go spend a bunch of money for something that may be potentially paid for in cash.
At this point, we've already reached out to the bond counsel we've utilized in past years, so that would be a sunk cost at this point. We are not going to move forward further than that.
But it's
until
already
told
cost you
otherwise.
some money, right?
It will cost a little bit, yes, correct.
Okay, so.
We will save quite a bit in administrative costs on our end, though. Obviously, we have a pretty small staff that works on these that carry multiple hats, so we would still view that as a positive.
Okay, just duly note that if this is part of that package, that I hope that you don't expend a whole lot of dollars, and because those dollars don't revert.
Indeed, understood.
Thank you.
Thank you, Mr. Chairman. Mr. Trump, when was the last time you guys were in the market?
I don't have that answer. I believe we were in the market in 2018 as a part of the ARENA project.
Okay.
I don't know what % we got on those, but our Moody's rating is A1.
A1 rating?
Yes.
You don't know what the rate was
I
that
don't
you
know what
paid
rate
on
we
the
got on
other
that
debt?
project, no.
And it wasn't fee replacement debt, so there was no backing of the state, right?
That was fee replacement debt.
That was fee replacement for the arena?
Yeah.
Okay.
Yeah, we utilized that for quite a few academic purposes, commencement, others. Our past space was not equipped to handle any type of student activity or commencement, for instance.
Do you believe your rating is going to go up or down from?
We believe it'll stay the same.
Stay
That's
the
our
same, good,
expectation.
okay. So I'm going to give you a 2.5% interest rate like
Okay.
Indiana State does.
Thanks,
And
sir.
which leads to my point, Mr. Chairman. Not to reiterate the obvious, but it's obvious that we're going to make some decisions in the next budget cycle, in the non-budget cycle, to cash fund some projects. I've made the argument that if you're going to cash fund projects, you should do it on the basis of which there's savings. And I read an article where the state budget director and several other people had indicated there were savings on these cash-funded projects. These projects are not like a mortgage. It's a market-driven industry that provides an interest rate to the people who provide the money. They receive the interest tax-free. Therefore, the interest rate that is applied to this debt is less. And let me give you an example. Just recently, the state of Indiana went into the market with what is called a state revolving loan fund program, which was AAA rated. And those bonds, over the term, were ranged from short-term to 1.5% to 2.8%. These bonds that we're talking about, I'm going to anticipate are going to average around 2.5%. I'm glad we got the A1, although I think Indiana University may receive a better interest rate. Mr. Chairman, respectfully, if you were to take the cash that you actually provided for these projects, and this is just taking into account the interest that is earned on the reserve balances that we have right now, it would result in a 1.1% interest rate earning on the cash. That's based on the rainy day fund and the state tuition reserve fund earnings that we have seen consistently over the years. coupled with the fact that if you don't cash fund, if you cash fund these projects, you don't have that money available for other things. And moving forward, when you go into the market with debt, I believe you're going to see a tick upwards of at least 50 basis points. And I'm just saying that just from what we've seen historically. So that lowers the value of cash right now and puts you in a position where your rate, whereas, you know, you can talk about interest rates, and no bond issue that we have goes over 25 years and they pay the debt off like we do in our home, so they refund it. So to say that it's going to save the taxpayers $300 million is a misnomer. That being said, we're going to take this money and fund these capital projects, being under the options of being fiscally responsible, and we've got other issues, including teacher pay, that we need to pay, teacher pay, class size rooms. We're going to take these projects and cash fund them. Now, I'm not, you know, I'm not the state budget director, nor am I in the governor's office, because I would say economically that's not the smart thing to do. But let's say we go ahead and do that. What do we say to the universities 3 years from now when they want to do another project? Because we're paying the debt service, not them. We are. We're gonna hurt their credit rating because we're gonna go in the market with at a higher interest rate. And I hope they understand this. I would not accept the cash right now, although they probably have no choice. Because if you go in the market right now, you're going to see the best interest rates you've ever seen, especially short-term rates. But we're going to put them in a position where later on their actual borrowing is going to cost more, and thus the taxpayers are going to pay more money. Respectfully, Mr. Chairman, I would want to see, once we do this, and I don't know, I can't speak for the other members of the Budget Committee, I would like to have an actuarial, and it'd be very simple to do, to tell us what whoever goes into the market, what their interest rate is and what their credit score is. So we have, this whole committee has an understanding of what we've done. Without that, when we go to make the decision in a few weeks of whether or not to cash fund these programs, not everybody's going to be in the same position, Mr. Chairman. I mean, these guys are going to be in a position where, you know, maybe USI, because they've already looked at bond counsel, I'm assuming they've looked at the market to see when it's the best time to go. But nobody else in here is going to be able to tell you, if we cash fund their project, what interest rate they could have received in the market. So I would think it would only be feasible for us to give the universities, if they want it, the opportunity to come back to this budget committee and say, this is the interest rate that we would receive if we were go to market with the debt instead of you paying cash, so that everybody's on the same page. You see what I'm saying? Hopefully that gives a better perspective on what we're doing, because again, I just don't understand why we're going to spend cash on these capital projects that have these great credit scores. That's why you have a reserve. That's why you have these reserves and everything, because we get good rates. And now we're in the best interest rate market we could do. So, Mr. Chairman, I would respectfully, if there's something that we could do during the session, I would at least want the universities to come back and tell us what market rates are doing for A1, AA minus, and that's easily to achieve. Last but not least, and I bring this up every meeting, and I hate to be Danny Downer, but we have a program that emphasizes spending money with diverse companies. And I've been saying this for a year, that the universities universities that put men on the moon, universities that have number 1, number 2 business schools in the country, somehow can't find a way to achieve the goals that we set by the state of Indiana to spend, and listen to this, 8%, this is good, 7% of your construction project goes to a minority-owned business, 5% to a WB, and veteran-owned business get 3%. Let's say professional services 8, and 3, supplies 4. Some, I would say, up to 15%, 16% of these projects are supposed to have companies that are underrepresented work on the projects. And the universities have to report to the commission that we created all these numbers. Some universities have done some things to change things, some universities have not. Some universities, quite frankly, and I will leave them nameless, have actually said they don't want to do it. But we allow them to receive over $1.3 billion in state taxpayer dollars over the by 2021 budget. And I think it's about time for us, and I have a bill that's going to address this, to actually have them come present why they can't do it. I mean, let's you know, Neil Armstrong went to Purdue. He made it to the moon. I mean, you know, the inventor of Crest toothpaste went to IU and was the smartest guy, you know. We've got all these great universities, and they can't figure out how to meet some goals that gives them the ability to spend 85% of every dollar whoever they want to. And they're still not doing it. And I don't know if they're going to do it until we take some, what in my opinion, some objective steps to do something about it. So I've got a bill that's going to require them to come to us, and when they come to a project, to present us with their past spending with minority, women, and veteran-owned businesses. And I have bipartisan support for it, Mr. Chairman. But we're going to, you know, there's another step we could go. At the city of Indianapolis, if you don't meet the goal in your bidding, the Department of Minority and Women Business Development can stop your project. That's pretty big. That's a pretty big stick. Right now, we don't have that. But I don't think it's too much to ask these universities to at least meet the goals. I mean, they get $1.3 billion of taxpayer dollars, and I think to meet the goals that we set by the state of Indiana is not too much to ask. And I keep bringing this up because these numbers that we're seeing are, some are getting better, I admit, but they're bad. So thank you, Mr. Chairman.
Thank you, Senator Taylor. Your point about borrowing money being an all-time low is true, but put yourself in the Hoosier taxpayer, and spending more money to borrow it than spending more money you have still is the antithesis of what the Hoosier taxpayer thinks about doing. And we have record amounts of debt in university projects. I think over $170 billion total over 20 years in debt. And to keep adding to that without thinking about how to pay that down and save that Hoosier taxpayer money is wrong. Mr. Jackson.
And I'll just further add that the governor's proposal to use $300 million, that comes directly from, to pay down these with cash as opposed to borrowing. That comes from the fact that between April, when the last revenue forecast came out, and when we closed the books in end of June, early July, that we ended up exceeding forecast for that year by approximately $270 million. And so what we're talking about is using one-time money that came in one time to pay off debt. We're not talking, and which in turn would free up money every year going forward by not borrowing for those.
Mr. Chairman, with all due respect to that the money's already been appropriated to pay the debt service. So to say it's gonna free up more money, we've already got in the budget, correct me if I'm wrong, these projects that we're paying cash for, we've already allocated in the budget the debt service. Right? So how are you so how are you saving, this is the question I have for both of you, how are you saving the taxpayer dollars by, you've already budgeted, remember, we have an existing budget. Tell me how you save over the time, how can you calculate savings over time that we've already allocated in our budget, so we've already got the money, and we've still put in there a reserve that we're gonna have, being fiscally responsible like we are, and then we find this cash, and how can you tell the taxpayer how much they're gonna save?
Because
What
the
if
total cost of a project is the debt over its lifetime.
If that
Debt
yes.
over its lifetime. And paying cash now is less than the debt payment over the lifetime.
That's simple, but it's not that simple. It also is a combination of what you would do with that cash if you had it in a reserve account, which we do. We have reserve accounts, Mr. Chairman, that earn interest. I just brought it up. You could earn 1.1. When you go into the market later on, when these...
You're paying, as you said, 2, 2.25, 2.5.
Right.
Which is more than 1.1. So in a Hoosier's mind, you're spending more money than you're saving.
I'll regress. I don't want to get into that philosophically.
Thank you.
Representative Porter.
Thank you very much. Well, the argument is there, discussion's there. This is just the beginning of days and hours of discussion, but your predecessor with Indiana Finance Authority, debt was at $4 billion. Now we're down to $2 billion. So I think that's doing some things, good things for Hoosiers. The point is that, you know, we're just trying to utilize the dollars that we have. And I mean, we're getting to that, but I think I just want to cut it off with that, say we have done that, you know, and your predecessor's done it well with the Indiana Finance Authority, going from $4 billion down to $2 billion in regards to debt to the state. So we've done it before, so we just need to continue to move forward. Thank you, Mr. Chairman.
Thank you. Thank you. Anything else on University of Southern Indiana? I didn't say anything about that. Thank you. Thank you.
Thank you, Mr. Chairman.
Thank you, Aaron. With that, that's the projects. Let us turn to the review items on the agenda. First is Ms. Taylor and Medicaid state plan waivers.
Thank you. Thank you, Chairman Brown. Allison Taylor, Director of Indiana's Medicaid Office of Policy and Planning. I have a handful of state plan amendment and waivers to present to you. The first one is the Support Act. Is that right? What's on your list? Okay, so the Support Act is also called the Substance Use Disorder Prevention that Promotes Opioid Recovery and Treatment for Patients and Communities Act, the Support Act. With this amendment, we are essentially coming into compliance with federal government. This act requires that our Medicaid drug utilization review provisions have the right amount of policy levers to reduce opioid-related fraud, misuse, and abuse. And our DUR provisions actually are in compliance, so we're memorializing that in our state plan to come into compliance with federal law, which would require states to have implemented these changes by, have a SPA submitted by December 31st, 2019. And there is no fiscal to this one.
Thank you. How many opioid recovery programs do you have in FSSA?
Okay. I thought you might ask. Let me see. I've got a report out. As you might recall, we have a substance use disorder work group. It's a statewide task force, and we've been partnering both with DMHA and several partners and providers from across the state, and we have increased capacity significantly over the course of the last year and a half. And
What's your success rate?
I think, I'm not seeing
And
it,
if
so
you don't know.
we'll just talk. I don't have it with me right now, but we are, I think, both from a clinical and evidence-based perspective, seeing really good turnaround. So I'm sure we'll be having more conversations. We report quarterly. And we've provided a handful of legislators the progress that this waiver's been making.
Thank you. I'm just concerned across state government, we have a lot of programs and everybody is highly variable. So, any further questions on this change? Okay, next, Ms. Taylor.
Okay, wonderful. I believe next reference is inpatient hospital medical education payment adjustment. That one, it's not meant to be on the agenda. So we're planning on presenting to you a state plan amendment that would have increased the amount for direct medical education and indirect medical education by leveraging a new supplemental payment program. However, given CMS released in November some regulations that really kind of re-look at that whole financing infrastructure and mechanism. And so our leadership team at FSSA, we need to push a pause on bringing this to you. So we will be back. We're going to work with our stakeholders. And once we really understand what's in that proposed regulation, then we can either proceed as planned or retool. So
So
we'll
item
remove that.
2 is next.
Okay, so, I'm sorry, what'd you say? Move on? All right. So next, I'm here to present the Home and Community-Based State Plan Benefit for the Division of Mental Health and Addiction. So this, also called AMHH, it provides home and community-based services for individuals and families who need help on a regular basis with SMI and co-occurring mental illness. And so DMHA colleagues had identified the opportunity to help more members receive more appropriate services by moving them from MRO over to this AMHH bucket. MRO is a little more rehabilitative. AMHH, my understanding is it provides a little more intensive level of services and would better meet the needs of individuals. And it has a small state budget impact, again, from moving from 20 to about 150 individuals potentially from MRO to AMHH, which is supported by state general funds.
Any questions? Thank you. Next.
Okay. Next, we have our Community Integration and Habilitation Waiver, also the CIH, and our Family Supports Waiver renewals. Family Supports Waiver we call FSW. And A&D, provides alternate to nursing facility admissions for adults and persons with disability. Oh, I'm reading the wrong one. So never mind. CIH and FSW, this one's the simple one. We're renewing for 5 years. And this is, we have to do this by 4/1/2020, and so we're presenting it to you today. Our colleagues in the Division of Disability and Rehabilitative Services did identify a handful of additional services in response to family and provider feedback that would help individuals stay at home longer and give them more pathways to stay out of the institution. And that involves environmental modifications to the home and electronic monitoring. So those are 2 enhancements in addition to the renewal.
Questions for Ms. Taylor? Thank you. Next.
Okay, next, Division of Aging Waiver Amendment for Participant-Directed Care. So this is the one I started talking about. It's an amendment to the A&D waiver, which provides, is an alternate to nursing facility admission for adults and individuals, persons with disability. And so this is for a pilot concept of empowering individuals to seek self-directed care. This is a limited pilot. We're opening it up to 4 individuals, and over that time, our team will really assess the infrastructure and see what the possibilities are for self-directed care. And it too, it has a very small potential state budget impact.
The amendment has that participants may choose their own personal attendants.
Right.
They're not other family members, are they?
Let me take a look. I think they can be. I might have to follow up with you in our Division of Aging that really works on this closely, would know more of the policies. But I think the idea is to give individuals a little more ability to direct their care. And
So aren't we going to be expanding Medicaid a lot, long-term?
I don't think so. This is a pilot for 4, certainly. So we're gonna assess this this option, but
Any further questions?
Just one comment, Mr. Chairman, please. I mean, when I age, I probably would like one of my family members to watch over me rather than a stranger. They should. All right. Okay. All right. Well, somebody's going to have to do it. Or not. Oh, that hurt. Okay. All right.
Senator Brown.
Yeah, I'd have to be paid a lot to take it. I had a question. I'm sorry, I had my hand. I didn't get up fast enough. Back with the medical education payment adjustment.
sure.
So the qualifying hospital has to be affiliated either with the Hospital Corp of Marion or IU Health, that's it?
Right.
So if a hospital system allows a resident or even a med student to travel through their system, but they're not part of this, they don't qualify then? Because
Well-
it's certainly changed from the traditional of several years ago, how those programs typically worked.
Yeah, I don't know the particulars of this proposal, so we could follow up. I don't know, it may end up changing as we go back, but we can definitely share with you the current methodology and what we potentially might try to get
So
through.
is this a federal requirement or is this our requirement, these restrictions?
There are federal restrictions on the use of intergovernmental transfers and supplemental payments that have existed for some time, but the federal government's taking another look at it and have issued proposed regulations to revise and tweak and in some cases really kind of rewrite those regulations. And because this potential payment stems from supplemental payment type arrangements, we need to pause for a second, see what's in the federal regulation, apply that to this proposal, and then think through if that is the right path or if we should adjust course. So it is a federal regulation that is causing us to take a step back and make sure this will work.
All right, well, I mean, there have been a lot of editorials and things about healthcare costs. That's not what I'm driving at here, although this does impact the charges when you have this in your system if you are providing medical education. But my concern is now, the way medical schools and residencies happen, you actually can spend, after the first 2 years of classroom time, you can spend actually very little time at your home school, so to speak, and you can be doing rotations literally all across the country. But you yourself may not be, the hospital that is, the host hospital may not actually be a teaching hospital. But if we're going to try to incentivize students to eventually land here after residency, then we would like our host hospitals, and maybe even a rural hospital that would host a primary care resident, for example, for a while, we'd love for them to be able to do that. And if this was an incentive that they receive, because there is a cost to training these individuals, it's not just they follow you around and shadow you. So if this incentivized them, then we would also have the opportunity eventually to maybe have those people actually move here.
Yeah, I think the idea and the policy behind greater IME and DME reimbursement is good. I think we're kind of aligned with that, but just figuring out the mechanism, and this is just one that unfortunately, given the timing, we just need a little more time to assess the interplay of the federal regulations
All
on
right,
this.
well, I would like to know if this
Yeah.
this restriction is ours or theirs. And then, not related to any of these items, but specifically, but more generally, since these individuals also, some of them anyway, will be required to be credentialed. We had this conversation in the Medicaid advisory.
We did.
And I do understand, I'm still waiting for those numbers.
Yes.
My understanding is this FSSA had tried to work with a software, these are my words, company or some sort of a developer to create a portal for our managed or our Medicaid eligible physicians or any kind of healthcare provider to be credentialed in order to receive reimbursement, and we're not doing that. And this is a problem I hear consistently from not just hospitals, doctors, but dentists who want to participate and provide services. And so I know you don't have that information probably before you today, but I would really like to know what costs we have sunk to date and what we are doing to expedite the process to make sure that those who are willing to participate in Medicaid programs, because we know a lot of healthcare providers may not, I shouldn't say a lot, but some may not want to, but those who are, we want to make it as easy as possible for them to enter the program, so.
Absolutely. I hear you, and we are absolutely aligned in the commitment to make this process better. The one you referenced, we did attempt to centralize enrollment and credentialing for all, up to 70,000 providers. I think when we do go back to the drawing board, which we're doing right now, step one's going to be really talking to providers and getting them in at the ground level. We want to be smart in our solution, and we'll really focus on provider feedback and what's the tangible stuff that we can do to make it easier and better to do business with Medicaid. So I hear you, and we'll report to you both on financials and next steps.
Well, good, that's good to know, but I hope when you talk to the providers, it is the small individual like a dentist, not the big.
We need to hear from them all. Yeah, we
Yes,
found
because they're the
it's
ones who carry the
complicated. It
most
is.
administrative burden.
Yeah.
And they're the ones out in the rural.
I hear you.
Further questions for Ms. Taylor? Thank you.
Okay, thank you for your time.
Thank you. Next, the Indiana Sports Corporation or Office of Tourism, Mr. Vaughn and Mr. Knox, or?
Thank you, Mr. Chairman, members of the committee. My name is Ryan Vaughn. I'm the president of Indiana Sports Corp. I'm joined today by Shannon Sullivan, who's the director of our statewide initiatives. Mr. Knox, unfortunately, is ill and couldn't make it today, but appreciate the audience. What Ms. Sullivan is passing around is just a copy of our letter of request that we issue every year, as well as some information regarding our economic impact of the events sponsored by the Indiana Sports Corp. And those sponsored by the separate grant program from Sports Indiana. The $550,000 grant allocation is broken up into a few different pots. The first is a $150,000 commitment on behalf of the state to be part of the Big Ten Community Partnership. That is a partnership that consists of the state of Indiana, City of Indianapolis, the Pacers, the Colts, Visit Indy, and Indiana Sports Corp., and it pertains directly to the number of events that we host for the Big Ten Conference. We have hosted the Big Ten Football Championship every year since its creation, just finished our 8th year. We host the Big Ten Women's Basketball Tournament nearly every year since its creation. I think we've hosted 24 of the 27 years it's been in existence. And this coming March, we will host both men and women's basketball, as well as following with another year of football. In addition to those events, which we've worked with the Big Ten, they've also hosted their men's and women's swimming and diving championships in Bloomington, as well as their softball championships at Bloomington. So it's a really great partnership for us. It currently extends through 2022, and the Big Ten Commission, or the Big Ten has a new commissioner, and Kevin Warren, and we expect to compete for the right to host these events through 27, beginning next year. The second part of the grant goes to the attraction of major events. We've had several great announcements of major events coming to the town over the next several years, but in particular, this year we were able to secure the 2020 FINA Men and Women's Water Polo International Tournament. That's actually the Olympic qualifying event, which will be at the IU Natatorium, as well as the 2022 Division III Swimming and Diving Championships. And then you may have seen on the news just recently, the 2022 men's first and second rounds has been relocated from Cincinnati to Indianapolis. And so we'll be happy to host a regional this year, a men's Final Four next year, a first and second round in 22, potentially a regional in '23, a first and second round in '24, a regional in '25, and a men's Final Four in '26. So college basketball is alive and well in the state of Indiana, for sure. We are also mid-process on the NCAA bids. They put out their championships other than men's and women's basketball in a separate competitive process. That process will conclude in early January. Last time we were part of this process, I think the state of Indiana won 43 championships over a 4-year period, and so we're being very aggressive. We would like to host a number of events both in Indianapolis and across the state. I'll now turn it over to Shannon.
Yes. As Ryan mentioned, the third bucket of our funding is dedicated to the statewide association, Sports Indiana, which is mission is to promote and grow sports tourism across the state. So the funding plays a significant role in attracting and retaining events in communities statewide. $100,000 of the funding goes towards community and bid support. This allows our members, which are highlighted in the map on the Sports Indiana impact page, to go after events for their communities and help retain them in their cities. So for 2019, we received nearly 20 applications requesting more than $210,000 in event support. With the funds we had available, we were able to award to 11 different events. Those are also represented on the map, and that was $100,000, resulting in a total economic impact of nearly $20 million from just those 11 events. That does not include all of the sports tournaments happening across the state, all the tournaments at Grand Park and Evansville and Fort Wayne on a regular basis. Those are just the grant-funded events. So a lot of sports tourism impact happening throughout Indiana. And those grant-funded events span 7 counties: Allen, Bartholomew, Delaware, Lake, Marion, St. Joseph, and Vanderburgh counties. In addition, with those events, we tracked a total of 18,000 room nights. So looking ahead to 2020, we've already awarded $30,000 to support 3 events, and we have some more applications coming in, and looking forward to reporting what we will be supporting in 2020. There is a list included in your packet of all of the 2019 and 2020 events currently awarded. In addition to the event funding, we use a portion of the funding for marketing efforts. One of our significant investments was in the Sports Economic Impact Calculator. That was developed with the help of Tourism Tomorrow and Rockport Analytics, so all of our members have access to this calculator. That's how we have come up with our estimates for you today. We also use the funding to support trade show attendance. This is where relationships with event owners are developed and where a lot of business is secured and brought to Indiana. We had 11 of our communities represented at the major trade show last year in Knoxville. And as Ryan mentioned, we're working on the bid process for the NCAA. Because of our relationship with the NCAA, they hosted a special session for our Sports Indiana members this October to answer questions specific to Indiana, looking at events that they thought would be the best fit for all of our communities. Like Ryan said, also 43 championships were awarded to Indiana in the last cycle, so we're hoping for more of those. In addition to all of the NCAA basketball events he mentioned coming to Indianapolis, we're very excited. In 2021, we have the men's Final Four here in Indianapolis, but the Division II men's Final Four will be in Evansville, and Division III men's Final Four in Fort Wayne. So all levels of men's basketball in Indiana, which is something we're looking forward to promoting.
Senator Brown.
Thank you. So I'm trying to figure out the portion. So the state's allocation is about $500,000. What's the rest of what's your total budget?
For the Indiana Sports Corp, it would look like about $9 million, but it's about a $3.5 million operating budget. And then each event has their own separate budgets that are sort of baked into that. So for example, if you're trying to figure out how much of this $250,000 for event support, we do significant fundraising outside of this appropriation to meet the needs of those events themselves. And so, for example, we're in the process right now of raising $25 million privately in order to pay rights fees and operating costs of all the events we have coming over the next 3 years.
So so you say it looks like 9, but it's really only a $3.5 million operating budget? I guess I didn't understand that originally.
Well, this is what it costs for the organization to operate, but again, there are costs affiliated or associated with each event. So for example, we do sell all the tickets, and all the revenue for Big Ten football will come into the sports corp, but then it goes right back out to the Big Ten. So
Okay, I get that.
it looks much larger than it really is.
I guess I would like to see them with the operation budget of that size and considering, I assume there's a significant investment from the local community, right? In addition, like Visit Indy or whatever, do these organizations help fund this?
The Capital Improvement Board contributes $350,000 to our budget, and Visit Indy contributes $100,000. The rest is private fundraising.
All right, so the state gives more than Indianapolis does, but, I mean, frankly, I do appreciate the, I believe, $10,000 that Turnstone got for their Paralympic event, which was really quite historic, but I'm a little dismayed at the only spending $50,000 on a marketing budget for I guess, the entire state, and only $100,000, which is about 3% of your budget is spent on the rest of the state.
Yeah, well, we can...
Now, I appreciate that because
Sure.
most of your money is raised from here, but we're giving significant dollars, well, not significant in your budget, I guess, maybe, but significant dollars, and yet the amount that's actually being spent statewide is pretty, in my opinion, insignificant.
Yeah, we would love to do more statewide. We've worked very hard with Sports Indiana to elevate the aggressiveness with which they're pursuing events. Some of that is, of course, limited by venue. It's natural that the largest events occur here because we have the biggest venues for those major events. But, getting 43 championships awarded statewide over the last bidding cycle we thought was a dramatic improvement over the previous cycle, and we hope to do even better. So.
Well, I appreciate that. I mean,
Yeah.
I know that our community has hosted rounds of NCAA. I think we've had maybe even an ice hockey that I forget now. And, but also, I think it's important to consider other communities like Turnstone, which had the Paralympics, the goalball, and the judo. We have some award-winning teams up there that are not in the more traditional sense. So I think it would be great if you started to expand in those areas.
Will do.
Senator Taylor?
Thank you, Mr. Chairman. Ryan, can you go to the back page of the document that you just handed out? I'm a little perplexed by the statement that most of the money's being spent in Indianapolis.
Well,
I mean, that's a statement that was just made. I'm a little perplexed by that when we see the breakdown clearly here for the resources that were provided to you from the state and where they're being spent.
yeah, we do not historically, from a local perspective, meaning Indiana Sports Corp. Focused on its Indianapolis venues, tap into these dollars that you're appropriating to chase those events. We spend that money with these communities outside of Indy.
Yeah, it looks like, let me just do a little simple math, 30, 40, 50, 60, 70, $80,000 was spent outside of Marion County in 2019, and $20,000 was spent inside Marion County. So that's a 3-to-1 ratio, 4-to-1 ratio.
Yes.
Okay, and then if you go to the next one, we're even so far this year.
Correct.
50% is being spent inside Marion County, 50% is being spent outside Marion County.
Yes, I think it is both true that we are spending the vast majority of the money outside of Marion County.
Okay.
And that we could do better statewide.
Well, Your political future is bright. I just want to make
mine's
sure.
over.
I can't, I just don't, I want the statement to be, because Indiana Sports Corp spends money outside of Marion County, although Marion County directs money out of their local budget to Indiana Sports Corp. I think that needs to be very clear. They receive no other local support from other communities across the state but Indianapolis. Just very clear.
Correct.
Representative Porter, do you have a question?
Thank you, Mr. Chairman. Ryan, you mentioned a lot of events that were occurring within the next 4 years, and I know you kind of glazed over the point that there are fundraising efforts to help generate those dollars for these main events, college football playoffs, NBA All-Star Game, and Final Four and others. And we're in Indianapolis, we're raising between $20 to $28 million to help operate those that will also feed out into throughout the state. Is that correct for me to say that?
It is. It'll cost us $25 million, which we are raising through private, individual, and corporate donations to host just 3 events: the NBA All-Star Game, the College Football Championship, and the Men's Final Four. And of course, with events that size, the economic impact extends far beyond the city of Indianapolis and the companies who are mostly very regional and who are contributing to that. You know, the vendors who participate in these events are all statewide for sure.
Okay.
Thank you. Any further questions or comments? Senator Brown?
Thank you, Mr. Chairman. I just want to clarify, I didn't say that all the money was being spent, but I am concerned. Your total budget is $3.5 million, and you may be receiving that significantly from here, but of the $500,000 the state gives you, $100,000 is spent outside. That's the $80,000 that was just tallied up roughly, correct? And then the $50,000 is your total marketing for the entire year? That's your total marketing budget?
Well, it's the
Or that's how you divide up the $550 we give you?
correct. That's how we divide up the 550
Right.
you've given us. The
But in
the
terms of
50.
the grants that were distributed outside the city of Indianapolis on this back page, that comes out of the $100,000 we give you, correct?
Correct.
Okay, so of your $3.5 million budget, I just want to make it clear, $100,000 is spent around the state. We give you over $500,000, and then you spend $100,000 of that around the state. And I understand your point about venues, but it was a little misleading when Senator Taylor asked you if half the money was spent more out than in, and that's not exactly true. I just want to make it very clear. We have some great venues across the state, and I want to make sure everyone understands. I appreciate the $10,000 that Turnstone received for its Paralympic national qualifiers in goal ball in judo, the blind judo, but I don't want to leave the impression with anyone that we are overspending outside the city of Indianapolis, and somehow the taxpayers of Indianapolis are paying for it and not the taxpayers of the state of Indiana.
Yes, I mean, we are using that $100,000 outside of the state, but of the $3 million that it takes for us to operate, again, 75% of that is private fundraising from the local community. Yeah.
Thank you. Any further questions, comments? Senator
Thank you.
Representative Porter.
Thank you, Mr. Chairman. I'm advocating on Chairman Brown that the letter that came over from you guys was a very nice letter and written everything, but Dr. Brown and his staff didn't get a copy of this letter. It was CC'd to other people, like the Senate. Nobody in the House got a copy of it. So I'm advocating for Dr. Brown. This is our bipartisanship on this level. But jokingly, but.
I think they were used to Mr. Dukes and copying him, and so that's where Miss Rivera just fell into Mr. Dukes's shoes.
Yeah.
Reynolds, yeah.
Thank you.
Any further questions, comments? Thank you very much.
Thank you.
Now we'll go to Marion University and Mr. Goodpaster.
Chairman Brown and the members of the State Budget Committee, thank you for giving me the opportunity to speak today about the Indiana Primary Care Scholarship. My name is Daniel Goodpaster, and I serve as the Director of Enrollment at Marion University's College of Osteopathic Medicine. In this capacity, I oversee the admission process for the College of Osteopathic Medicine and the Master of Biomedical Sciences program. In our first 3 classes, as of May 2019, we have graduated 442 new osteopathic medical students. Of those, 136 have participated in the Primary Care Scholarship Program. Specifically for our graduates, in our first 3 classes, primary care specialty areas of family medicine, internal medicine, obstetrics, gynecology, pediatrics, and general psychiatry, ranking the top 5 of the top 7 specialty areas our students are completing their residency. So far, this year, as of late November, we have awarded 93 unique scholarships. That's total a little more than $1.1 million. I can tell you as of today, we have awarded 100 unique scholarships totaling $1.2 million, and we expect that number to increase to 134 unique scholarships by the end of this academic year. Overall, the decision to incentivize students to work in primary care and serve the state of Indiana after graduation has been overwhelmingly positive. Remember, our mission at Marion is to produce doctors for the state of Indiana, and annually more than half of our incoming students are residents of the state. If you look at osteopathic physicians nationally, nearly 57% practice in primary care. For Marion, that number is over 62% of our students go on to practice primary care medicine. So we are producing primary care doctors higher than the national rate. With that, I'm happy to take any questions.
Any questions for Mr. Goodpaster? Representative Porter.
Thank you, Mr. Chairman, sincerely. As I look at your letter, it talked about, like to express the concern, look at state supporting their primary care scholarships because of what it produced. In the budget, at one point, it was primary care shortage areas. Why is that not there anymore? So why is it now you're just going primary care now versus going into areas that are underserved? How did that happen? I asked the commission, higher ed, and they didn't know anything, and they didn't get back to me, and they say it was done legislatively. So I know this is something that Dr. Brown is important to him, but why are we taken away from going to areas that are hard to serve?
Representative Porter, I do not know the answer to that question, and I apologize. I'm happy to speak with others who have been part of this scholarship and try to get back with you with that answer, but I'm not sure why that has changed.
So does anybody know why that happened?
Again, some of why we have such a high participation rate in primary care is the ability to work together and work with somebody that you trained with, somebody that you went to school with. So I'm sure that looked at those people able to stay together and where they could go.
Dr. Brown, from my perspective, that has nothing about training and working with. I think how you're going to go and try to provide services and access to health care to these hard-to-staff areas. And we're going from $10,000 up to $15,000. Is that correct? So why? I mean, why all of a sudden it was good, now all of a sudden it's not? We switch in the middle.
Again, I think because you have more participation, more wanting to use it.
So you don't. So I can take advantage of it, and I don't have to go serve. I can go serve who I want to serve. Okay, I don't have to go or be. even though we give state dollars, you talk about state dollars and anything like that. So I can go and serve the people who I think I want to serve versus people that really need it. So we're gonna create a two-tier medical system within communities, or not? I mean, that's my question. You don't see it that way. Okay.
No, Indiana is below the national average in supply per physicians per population, so going anywhere is a positive.
I have a question. What do we appropriate for this program? What do we appropriate for this program? We pay $2 million? Okay, that's what I thought. 93 recipients, right? All the way through right now?
So we're currently at 100,
Okay, good.
currently at today, as of today.
I think I asked this question before. Nobody's provided me any information. How many of those people are people of color?
So 8% of that number are, 8% are students from typically underrepresented in medicine backgrounds.
Did you break that down by classification?
I have not. No, I can do that for you, but I haven't.
Can you get that information to me?
Yep.
I want to know how much is spent per classification.
Absolutely.
Okay, thank you.
Senator Brown?
Thank you, Mr. Chairman. So I'm concerned, you have 6 students currently not in compliance, receive scholarships.
That's correct.
So what does that dollar amount to?
I'm not sure because those students have been were dismissed or took a leave of absence and did not come back for academic reasons or for medical reasons. But I can get you that information, but I don't know what that dollar amount is off the top of my head.
Okay, but so in terms of clawing back those dollars, that's not your responsibility, is it?
So we have actually partnered with the Commission of Higher Education's partner with ECSI to retrieve those dollars, and there's a process now where all the students who receive the scholarship, they're given a form, they're sent a form to fill out, and as soon as we figure out they're not in compliance, ECSI takes that over for them to pay back the scholarship, those scholarship dollars.
With interest?
Yes.
So Marion is not on the hook, though?
We are not, no.
Okay, and
Correct.
so I think the impetus was to incentivize certain high-need residencies to be filled, because this is just they're only going to come out with the DO at the end, right? So they're still going to go on to get a residency. And the idea is with this scholarship, if I'm correct, is after they finish their residency, they should pick one of the high-need areas, A, and then B, come back to Indiana, right?
So they'll begin their residency in one of those high-need areas determined by the scholarship, as I read off.
Right.
And so sometimes, since there aren't enough residencies in the state, sometimes students, and we haven't had this happen yet because we were so young, but students will go outside the state to complete these residencies. What we're hoping, just as you said, we hope those students come back to the state and practice in those high-need areas.
Right, but I thought the point was they had to come back in order for this. Isn't that what they sign when they start with this as a first-year student?
Yes, and we have not had students, we have not been around long enough for students to complete their residency. It
Right.
should start this summer, so we are hoping that those students will come back to begin the residency in those.
But again, you're not on the hook. We're going to have to, or higher ed will contract with that company you mentioned, and they will claw back the dollars.
That is correct.
So they have to track them,
Correct.
and it's 5 years out.
About three to 4 years for the residency, yes.
Well, right, that's 3 to 4, but isn't it 5 years out when the clock starts ticking that they're supposed to be here working?
3 to 4. So after family medicine residency completes in 3 years, so actually starting this summer, summer 2020, our first graduating class will be finishing their residency to be attending physicians.
And do you know where they all are right now,
Yes,
your graduating classes?
yeah. We know where our graduating classes
So
are.
then why in this report as well, does it say, when it was asked how many pursued a residency in Indiana but did not match into one, you say, this isn't information can't be known? Did you
So-
ask your students that?
Sure, so we are not able to know if they pursued a residency in Indiana and didn't match. So we know the students who pursued a residency and did match in Indiana, but we don't know the information of how many of our students did not, or pursued a residency in Indiana but did not match into one. But
Why don't
matched.
you ask them that?
That's a great question. One of the reasons why is because if they do apply to residency in Indiana, if they're not selected, we can't get that information from program directors.
But you can ask
from
them.
The
You
students.
don't ask the students?
We ask the students what they're interested in pursuing, but we don't ask where they're interested in pursuing that.
Okay. So obviously you can see I have a little bit of a concern with this program.
Sure.
Because the payback is so far out. And really what we want is we want them to land here, right? Because
Absolutely.
we do have a need.
Absolutely.
So we want to incentivize them, but incentivize them when they're out of college, starting your program isn't really an incentive because they don't even know what they're going to go train them in yet. And they're not sure where they're going to land yet. And do any of your students also have some military obligations to fulfill at the same time?
Some students, but students who are in the military, they don't take part in this scholarship because typically students with military HPSP scholarships, they're contracted with the military, so they go and do their
Sometimes you can
rotations.
defer it.
What's that?
Sometimes you can defer it as well.
Okay.
All right, I would like to see a little more information from your school's position when a student walks in the door as a first-year student, what kind of information you're incentivizing to them as opposed to just us paying for part of the tuition for them to go to your school. Because the whole point of this is we need more physicians practicing in this state.
Absolutely.
And we need more primary care physicians, regardless of whether in the city of Indianapolis or in a rural community. But if you're not tracking them, and if we can't see how you're marketing to them to encourage them to stay here, but we're just paying the tuition, this isn't really paying off for us, is it?
Okay.
So, thank you. I look forward to those numbers.
Any further questions or comments? Thank you very much. Next is Indiana Economic Development Corporation, Mr. Waskey.
Thank you, Mr. Chairman, members of the committee. Mark Waskey with the IEDC, here to present an Edge for Retention project for your review, which should look fairly familiar to many of you. In December of 2017, we began conversations with United States Steel Corporation regarding their plans to invest a significant amount of money into their U.S. operations and what the state of Indiana could do to be able to secure a significant portion of that in the company's Indiana facilities. Through the course of those negotiations, the company indicated that they were interested in investing in Indiana, but did not have any plans to create any new jobs as a result of that. So we began to explore our different incentive tools, what we might be able to use to incentivize the company to select Indiana, and ultimately made an Edge for Retention and Skills Enhancement Fund offer to the company, $10 million in Edge for Retention and $2 million in the Skills Enhancement Fund trading grants in exchange for the company's commitment to invest $750 million in their Gary Works facility, as well as to retaining 3,850 jobs at an average hourly wage of about $30 an hour. We continued negotiations with the company after we brought this project to your review in October of 2018. And during the course of those conversations, the company asked for a reduction in their base employment figure that was presented to you last year. We ultimately came to an agreement with the company to lower their base employment from 3,850 to 3,750 jobs that would be retained, while ensuring the company was still planning to invest $750 million in Gary. That is why we're here today. The terms of the agreement had changed slightly in that we were securing a commitment for a lower number of jobs that would be retained while still providing $10 million in EDGE for retention tax credits, but we would no longer be providing the $2 million in CEF training grants, as it was an important project for our job creation efforts across the state. So in terms of numbers, there is about a 2% reduction in the company's overall base employment figure, which is not due necessarily to layoffs, but rather through some anticipated attrition from current employees who would be retiring or moving on to other positions. And we would then reduce our total incentive package by about 16% in total value. So we do feel that this is still a very great deal for the city of Gary and for the state of Indiana. And with that, I have here today with me representatives from U.S. Steel if there are any specific questions as it relates to the company's plans, but happy to answer any as it relates to the IDC incentive offer.
Questions? Senator Taylor?
Thank you, Mr. Chairman. I wanted to ask you just about the EDGE tax credit as an overall program. When it started, we used to tell the companies, whatever your tax liability to the state of Indiana, we're going to give you credits based on a percentage on that. If it's over, go have a party with the check. Is that still the same program?
Yes, so EDGE is still a refundable tax credit, yes.
Okay. So that being said, with the lowering of the state corporate income tax, doesn't that seem to act counterproductively? We're lowering their liability once by lowering the rate, right? And then we're lowering their tax liability again by giving them EDGE tax credits. They already only contribute, even according to earlier conversation, 5% of our total revenue to the state of Indiana from taxes. So, are we going to get rid of the program? I mean, if I have no liability, I have no. Can they? But you know what? They can syndicate those credits, can't they?
They cannot. No.
They
not this
cannot.
program.
Okay. Well, all right. I mean, where do you see the program going in the future?
So the program itself and the IDC's incentive award is calculated not necessarily based off of the company's tax liability, their corporate income tax liability, but based off of the incremental income tax withholdings that are paid to either new or retained employees by the company, depending on the specific EDGE tax credit that we're providing.
Say that again?
The incentive award is calculated based off of the withholdings taxes that are, well, the taxes that are withheld from the company's employees. So it's not necessarily based off of the company's corporate tax liability and the size of the award. It's based off of the number of new employees or existing employees and the wages that are paid to those employees.
Oh, so it has changed. So it's not their corporate tax liability that the credits are used against.
It's used against that, but it's calculated based off of the withholdings taxes that are withheld from the individual employees.
So they can use these credits against their withholding for the state of Indiana?
The company uses it against their corporate income tax liability, but the credit itself is calculated based off of the income tax withholdings generated from the project.
Okay, I know how you, okay, but it still defeats the purpose of the program if we keep lowering the rate that they have to pay in corporate income tax.
It definitely makes Indiana far more attractive over the long term if the long-term costs for the company are lower. But this helps us address some of the short-term costs associated with investing in the state.
Yeah, I wondered when we're going to get that question of whether or not we let them syndicate the tax credits. I'll leave that up to Doc Brown, though.
Any further questions? Thank you very much. Then we have the Indiana State Police. I think Superintendent Carter left and left somebody else in charge.
Good afternoon, Mr. Chairman. Mr. Chairman, as you notice, I'm not Superintendent Carter. As good a mask as I might put on, it's not working, right? The superintendent had a family matter that he had to attend to. You've seen him here earlier, but he had to excuse himself, and he sends his regrets. With me today, or to introduce myself, if you don't remember, I'm Charles Sorrells. I'm the HR commander for the state police. With me today is Pam Douglas, HR manager. I have John Benge, actuary from McCready and Keene, Marcus Bowling from LHD Consulting, and then Ryan Locke is with us as well from the Treasurer's Office as the trustee over the OPEB funds. And then Andy Blau from MPERS is here as well. I want to take just a quick moment of your time, if I may, to go over some highlights for what changes we've made in the OPEB fund that we introduced last year, then a year of experience with that, and then some changes in the overall insurance plan as well. So at the end of 2018, we met with the committee and introduced that we were going to be moving a portion of our Medicare eligible retirees to a Medicare Advantage plan, group plan. And we were able to successfully do that beginning January 1 of 2019. And through that move there, which moved a significant amount of our liability away from the department, coupled with the legislative change for the investment strategies to allow us to invest the assets that are already in the OPEB fund, 401H and 115 trust combined for the Indiana State Police. Those two things coupled together formed a partnership with the state police and through the budget agency and with the legislative cooperation to reduce the unfunded liability of the OPEB the most significant way it has since 2010 when it was adopted, when the GASB rules changed and the OPEB liability was then handed to us to address. We are very, very thankful for those partnerships that allowed us to move forward to do that. With the State Police Healthcare Plan, which the OPEB funds are completely separate from the ISP Healthcare Plan. And with that, what we continue to do is to make a more healthy population, if you will. Try and get our people as healthy as possible. That way, when they go into retirement, they're not going to be a further liability to us. And so what we are seeing is Superintendent Carter, since he was appointed in 2014, has made the overall health of all employees a very high priority. From 2014 to 2018, we have had a 31% reduction in cardiac-related expenses, which is a huge step forward for us on a lot of levels. Seems counterintuitive, though, as we've had an increase in cardiac appointments and coding. And what that is early detection and awareness. So we see an increase of people having cardiac care, but the expenses are dropping dramatically because we're having early detection and our people are becoming more healthy overall. Another metric that we use that was introduced to us this year from 2018, there's a risk factor rating that Anthem uses, and the way that is calculated is by analyzing diagnosis codes and the demographics for ISP members and then comparing them to Anthem's overall book of business. And you want to be as the benchmark is 0.10. I'm sorry, is 1.0. And in 2018 to 2019, we reduced our score by 23.5%. So we made a significant gain toward the benchmark of 0.10. Another indicator that our population long-term is becoming more healthy. It's not a spike in activity. This is something long-term that we've been going after. In the past, we talked about tobacco cessation, diabetes, different things that affect heart health, and these are evidences that we're making gains on that. Another metric that we have is our hospital admissions, and the days in hospital has reduced as well, which is another significant indicator and a overall contributor to a reduction of our healthcare cost. Then on an administrative side, the Indiana State Police joined the Indiana Aggregate Prescription Purchasing Program, otherwise known as IAPPP. When we were able to, the key factor there is, one, we got into the program. Two, we have had significant returns in rebates in the first few quarters that were from the first and second quarter, totaling just under $800,000. With that, what we were able to do from the state police side is we were able to negotiate a carve-out. And what that means is that we were able to enter into this program with zero administrative fee costs. And when you look at that in the industry, it's usually $10 or $20 per employee per month, which in our case is somewhere between a $250,000 and a $500,000 savings. Also, we have we entered into a program integrity. It's called a program called Program Integrity, and it is simply a fraud and abuse investigations tool that Anthem uses. Our estimated cost savings there for this next year is going to be $350,000. The one thing about that is we were able to actually negotiate caps into that. So the fees based on that are based on the amount that Anthem saves and detects in the fraud management. And we were able to be one of the only people to negotiate that with a cap. So that balances out the services provided by Anthem versus what ISP pays. We also made a COBRA administrator change, which is savings of $20,000. And then we also engaged, we're the only state agency that engaged in a plan design change called RX site of care. And what RX site of care is where you have drugs that are normally infused or taken in a hospital setting or a doctor's office setting. Certain amounts of those drugs are now being able to be done at a off-site or a at home even in different occasions. And our estimated cost savings there this year will be somewhere between $77,000 and $143,000. With that all said, and looking at the overall health of the plan, our reserve is in good shape. Our plan is operating very, very well, and we don't have exuberant benefits. There's nobody taking advantage of anything free premiums or anything like that. We do a lot of preventative cares, prostate, mammograms, heart scans. We do a lot of things that are preventative medicines, and those are, by the metrics that we shared earlier, are proving that they're paying off for a healthier population, which drives down costs overall. With that, looking then to the OPEB liability, when the OPEB originally was incepted to us in 2010, it was approximately $400 million. There was a time in there where there was a discount rate change and a mortality table change, and there was an increase in the OPEB liability, but it wasn't based on anything that the state police had done or a program that the state police had. At that time, the projections to reach zero or a zero liability or fully funded was somewhere around 30 years. And as per the most recent NIHART report that we received this last week, we are 69% funded and a outstanding balance of $60.4 million remains. With the change in the legislative ability to invest the funds for the OPEB, which are somewhere around between, depending on what report you look at, $140 to $150 million are in the assets of that fund. Those will be transitioning in the first quarter into a investment strategy that is much mirrored to our pension strategy. And the investment policy statement that governs that should be voted on within the first quarter of 2020, and then those monies move forward there under the guidance and under the oversight of the trustee, the treasurer estate. With that, that's a quick overview of where we're at as far as the healthcare plan goes and the OPEB and the current OPEB liability.
And with these changes, you still have good acceptance of the state troopers of these plan changes?
Yes, sir. The group of retirees that we moved to the MAP or the Medicare Advantage plan, when we push that plan out, we actually sent out quite a bit of mailings, and then we went to every district in the state and had either one or multiple meetings at each district in the state inviting the retirees in to attend a meeting so we could explain the changes there. We also met with what's called our Pioneers Group, and we explained changes there to them. And again, like I said, we did a number of mailings, very thick packets of information that we tried to keep as streamlined and unconfusing as possible. And we've had a tremendous response back that the new program that those folks are in is very much appreciated, and they like it.
Senator Tallien.
Thank you. Did you guys present this to PMOC this year?
I wasn't at Piedmont, so no, we did not. No, ma'am.
Okay, yeah, because I was surprised to see this for the first
The
time.
With the OPEB separate from the pension.
Well, I know,
Yeah.
but it's okay, so that was my other question. What you're giving us today is totally separate from the pension liability. These are just the extra benefits. And do I get this, that the extra benefits pool of people is people who retire but who are not yet Medicare or who are not at all Medicare eligible?
Yes, Senator.
So these people are entitled to benefits for a limited amount of time. If you retired at 55 and you can't get Medicare till you're 65, they've got a 10-year window, right? Is that pretty much right?
Yes, Senator.
All right, and so I missed where you are. You said something about, I missed the number. After you've made these changes, in 2019, your unfunded liability on this portion is now 214.2? Is that what I'm reading in this chart?
Yeah, so I'm sorry, I should have prefaced that before I started, ma'am. The chart that you have in front of you, there's two actuaries that are represented here in what we were speaking about, and I apologize for not clarifying that. The chart that you have here, in-house, we use McCready and Keene as our actuary. And when they do actuarial figures, they use what's called an open population. It gives us a long-term snapshot of where we're going. And with NIHART, when they do their calculations, they use a closed population, which gives you a right now picture of where you're at. So the numbers that you see here are numbers that were available prior to the NIHART report coming available this past week. And these were using very conservative assumptions, and they don't also include gains and losses that weren't available through the NIHART report at the time. So when we presented these numbers here, these were projections that we had prior to having the information that would have been available in the NIHART report. So the actual, I guess the official, if that's a good term to use, unfunded liability right now is $60.4 million, and the funded status is 69.4. It's in the NIHART report.
Huh? Okay, all right, so that's not necessarily on here.
It's not in here, ma'am. No, that's what I'm saying. These numbers in this chart were from a different
Yeah, I know,
actuarial
but I didn't-
calculation.
Yeah, I
prior
know
to
you
NIHART
said
being-
it, but I didn't see it on here. That's why I was asking.
I
So,
apologize.
all right, you've moved your unfunded liability down by a lot over the past just few years, right?
In 1 year, it's over $300 million.
Yeah.
In 2019.
Yeah, no, I remember when you started this, so good job. Thank you.
Yes, ma'am. Thank you.
Mr. Jackson.
I just wanted to say, and you guys are up right now, but I'll kind of direct this at the other plan, the DNR and conservation and excise. I know I can, and my office can kind of be a bear at times on these things. And I know we've kind of struggled to get on the same page timing-wise, but just want to say how happy I am with kind of the overall results and where we are with this. So congratulations to both groups as far as all the progress you've made on this in the last couple of years.
Thank you, sir. It's very much appreciated.
Further questions or comments? Thank you very much.
Thank you, sir.
Next, we have the Department of Natural Resources and Alcohol and Tobacco, Mr. Din.
afternoon. I'm Indiana Conservation Officer Captain Keith Dinn, representing the Conservation Excise Insurance Plan. As far as the layout of the presentation, I cover a lot of the same topics, but specifically, we are also participating in the IAPPP, and the IAPPP for our plan is going to be saving us, or has been saving us, approximately $315,000 over this last calendar year. The rebate program has worked out very well. We're averaging about $100,000 per quarter. This third quarter is going to be approximately $116,000, so it's worked out very well. It's a good savings. Now, the next piece that we're looking at is the Medicare Advantage plan, and that is the salient point as it relates to the OPEB liability, and it's a huge piece that I need to focus on. For the Medicare Advantage transition, 2 years ago, looking at the OPEB liability, we were approximately 41 million, and then we had an uptick to approximately 53 million on the OPEB liability, which we were going in the wrong direction. So with actuarial input and guidance from our consultant, we looked at the Medicare Advantage transition, and that transition looked very favorable in that it would move the 123 retirees that we have that are Medicare Advantage eligible from our self-funded plan to a self-insured plan, and that would have a very positive effect on our OPEB liability. So looking at the numbers, as far as the pre-1/1/2020 change, which is the transition of the 123 retirees to the Medicare Advantage plan, we were on a glide path that was extended as far as OPEB liability goes. But with the integration or the transition of the retirees to the Medicare Advantage plan, the actuarial analysis looks at, on 1/1/2020, a reduction of the OPEB liability by approximately 34%. We're currently at $23,358,000 on OPEB liability, and on 1/1/2020, again with a 34% reduction, it'll cut that approximately $7,500,000, and that'll put us on a glide path to zero on 2032. So the decision to integrate the transition to the Medicare Advantage plan has a very favorable effect on the OPEB liability, and it's something that we are absolutely focused on, and we'll continue to work towards reducing that even quicker if we can. For 2020, we also increased our premiums approximately 2.5%, and we're moving the 123 Medicare eligible retirees off of our commercial plan. We're continuing a robust education program, although our membership tends to be a little more active, outdoorsy, if you will. We still maintain that educational program to focus on topics such as skin cancer screenings, being that we spend a lot of time out on the water and outdoors, and then also on mental health, which is a huge focus for us this particular year. The two trust funds, the two OPEB balance at this point, the trust fund for the DNR side is approximately $21 million. The trust fund for excise or ATC is approximately $6 million. With our reserve, we are approximately $30 million. So the current $23 million in unfunded liability and the reserve and the trust fund combined looks favorably upon our movement towards reduction in OPEB liability. Sir, do you have any questions?
Questions? Yes, thank you very much.
Thank you.
Thank you. Next, we have the Department of Child Services, Mr. Fletcher.
Good afternoon, Chairman Brown, members of the committee. We're here to basically present the foster care grant award that we're anticipating received for federal fiscal year 20. This was built into part of our budget, and the estimate is approximately $137 million. And it's basically used for foster care, family-related home payments, as well as other things such as substance abuse for foster care family treatment and things of that nature.
Thank you. And this is all federal money that...
This is all federal money, sir.
Yeah. Okay. Further questions or comments? Senator Brown.
Thank you, Mr. Chairman. What's your number for children in foster care currently?
I don't have that off the top of my head. Let me look to my colleagues. My colleagues may have that. I don't think either one of them do. But we can find that out pretty quickly for you, Senator Brown.
Has it reduced at all in the last year?
I hesitate to give you an answer because I don't want it to be incorrect. And to be honest, I look at so many numbers every day that I would hesitate to give you an answer right off the cuff.
Okay, because I thought I had recently read...
But our numbers, our numbers overall are going down, and they continue to decline year over year, month over month.
I thought I had read that recently. And so this was anticipated when the budget was passed, right?
Yes, ma'am.
So, and it goes towards foster care specifically for those children. So with the perhaps decreasing numbers, are you also looking at a decrease in staffing at all?
No, basically our staffing, our goals for our FCMs is basically 5 FCMs for 1 FCM supervisor. This allows them to have more interaction and more in-depth knowledge with our families and children. And it basically what we see is that it results in better services and potentially able to really get those families and children out of the system faster as long as they can stay in a safe and stable environment.
Right, I get that. I understand the ratio has expanded, so to speak. But if the numbers are going down significantly, even with that reduced caseload, your overall staffing numbers should be going down as well at some point, right?
That is potentially possible. At this point, it is not. We basically look to continue to add people because we still have fairly high attrition rates. Family case manager is a very stressful job. And so in order to meet our ratios and maintain those ratios, we still have groups of individuals that we're looking to hire to basically make sure that we can provide those services for families and children.
Well, I'd like a snapshot, if you will, of what your current numbers are in terms of children in the system and also what the staffing numbers are. And then I also have had some concerns. Let me go back. So besides the foster care reimbursement to families at this grant, you'd also said it went to pay for care for the children, like mental health services, things like that?
This is
that
basically
correct?
things, family home payments, substance abuse, and similar things of that nature.
Okay, and so are you current on all of your reimbursements to vendors who are providing these types of services?
Basically, this morning, ma'am, I have about 2,800 claims in my system, with the average of those being no older than approximately about 28 days. And so most of our vendor payments are caught up.
Most of your vendor payments are current?
Yes. If they are not, we've definitely encouraged vendors to contact us, make direct contact with me, and we can make sure that those payments are either investigated to see where they are and why they may not have been paid, or we can make sure that those payments are being pushed through the system as fast as possible.
With the right safeguards? Because I had received some calls from some vendors who were 90 days out.
Yes.
And you're caught up?
Yes,
mostly.
ma'am.
All right, thank you.
Thank you. Any further questions? Thank you very much.
Thank you. Have a great day.
Ms. Blackwell with the Attorney General.
Good afternoon. Mr. Chairman and members of the committee, I am Joan Blackwell, and I am the General Counsel and the Ethics Officer for the Indiana Attorney General's Office. I have with me here Clinton Baum, who's our Director of Finance. Many of you know him. I also brought with me Amy Hendricks, who is our Director of the Unclaimed Property Division. We're here today to request approval from the Budget Committee to use paid social media advertising for the Unclaimed Property Division. And that's required now under Indiana Code 42615.5. And that legislation was passed in the last session and came into effect in July. I know you're aware that our office administers the unclaimed property for the state, but what you might not know is there is over $540 million in unclaimed funds sitting there waiting to be claimed. It's our statutory duty to return those funds to the rightful owners. We're seeking approval to use permission for paid social media. That's like Facebook and Instagram. And the intent is to raise awareness of the unclaimed property program so we can get the money back to the rightful owners, which is citizens. I hope you're aware of our unclaimed property website. It's www.indianaunclaimed.gov. And you can go to that site. That's where you can search for your own name, your family members and friends, and see if you have money listed in there. We also know there's also a lot of other sites out there that look official. And they may be unauthorized sites, scam sites, or they may be sites that aren't illegitimate in themselves, but they charge people a fee. So people go to that, and they may ultimately get some of their unclaimed property, but not all of it. We get complaints from constituents that they've either been scammed or they later learn they went through a site that charged a fee. So what we want to do is make people aware that they can go to the state's official website and get the money that's rightfully theirs, or notify a family member who has money listed in there and not pay a fee. We've developed a plan that we would like to roll out in 2020, and it does have a big social media component in that plan. And we found, or the people we rely on, our comms people and the people from unclaimed property, we found that using social media is more effective than other ways to reach people. The unclaimed property statute does require that we place notices in newspapers, and you may have seen the inserts over time, in your local paper where it lists names, and that's certainly one tool to reach people, but we want to expand the approach to reach people better, and quite frankly, reach people in the way that they are getting information now, and that now is more social media. We can use those marketing tools, we think, to reach people more quickly, more efficiently, and in a far more cost savings manner. And those reasons are why we're here today, and that we believe those are the reasons why it's a compelling public policy reason to approve this request. We return, I learned from Amy, about $1 million a week in unclaimed property. And it's a lot, but it's not enough when you look at how much is still sitting there. So we want to increase that, and we think by using social media, it's the fastest, quickest, most efficient way. I do want to clarify, we are not asking for more money. We have money allocated to us and actually set aside for social media campaign if it's approved. We think it's the best way to use it, but I wanted to reinforce we're not asking for any more money. We just know that after the change in the statute, we need to come to you to explain to you why we think this is important and what we intend to use it for. So I'm happy to answer any questions. I know Clinton, if it's a fiscal matter, can answer it. If it's a little more detailed as far as the unclaimed property division or the communications I'm talking about, I can have Amy answer. But thank you.
Any questions or comments?
Thank you, Mr.
Representative
Chairman. How much is this going to cost?
Well,
So the current plan is for $400,000 over the calendar year, so that would be $200,000 in this fiscal year, and then $200,000 next fiscal year to cover calendar 20.
And that's just strictly for you said Facebook and Instagram?
That's for the social media portion of the advertising plan.
$400,000 for social media? Over 2 years, $200,000 per year for social media?
That's correct, sir.
No, they in the wrong business.
Any further questions? Thank you very much.
Thank you very much.
Appreciate your time.
Mr. Chairman, we're going to divide the question, correct?
Yeah, correct. We have an agenda before us, and the agenda was placed on the table, I'm sorry. but we have divided the agenda in that every item, but this item will be voted on first. What is the will of the committee? But the motion is to approve the agenda except the Attorney General portion. It's been moved and seconded. Further discussion about the agenda? All those in favor say aye. Aye. Okay, now there's the motion to approve the Attorney General's portion and presentation of the agenda. A motion to approve? Is there a second? It's been moved and seconded. All those in favor say aye. Aye. Opposed, same sign. Okay. It does pass, and so therefore the agenda is approved. With that, we don't have anything else on the agenda. We're housekeeping session coming up. I don't know if we'll have a budget committee meeting during session, though Mr. Jackson has told me there are things that will be waiting in the springtime, so we'll be trying to communicate either March or April, maybe March, to have a meeting. Thank you. Thank you. We are adjourned.
Could have come back with a comment like, you know, your family.